A very good morning, ladies and gentlemen. We'll begin the conference in next 2 minutes. We request you all to kindly be seated and please switch your phones to silent mode. You may bring your tea and coffee cups to your table. We are starting in next 2 minutes. Auspicious note by inviting the esteemed dignitaries present here to light the ceremonial lamp. May I request Mr. Rajesh Bhushan sir to kindly proceed for lamp lighting ceremony along with Dr. G.C. Khilnani, Dr. Professor Daljit Singh, Mr. Anil Rajput, Padma Shri Dr. Harsh Mahajan sir to please proceed for the lamp lighting ceremony. Ladies and gentlemen, a round of applause as we now light the ceremonial lamp. We request the dignitaries to please come together for a group photograph. And now, ladies and gentlemen, please join me in welcoming our esteemed dignitaries on the dais. Please put your hands together and welcome Mr. Rajesh Bhushan, former Secretary, Ministry of Health and Family Welfare, Government of India, and Chairperson, Governing Council, Illness to Wellness Foundation. A very warm welcome to you, sir. Kindly keep the applause going as we now welcome Dr. G.C. Khilnani, Member Advisory Council, Illness to Wellness Foundation, Chairman, PSRI Institute of Pulmonary Critical Care and Sleep Medicine, PSRI Hospital, New Delhi. A very hearty welcome to you, sir. Now let's welcome Dr. Professor Daljit Singh, Vice Chairman and HOD, Neurosurgery and Unit Head, Neurointervention, Max Smart Super Speciality Hospital, Saket. Can we welcome him with a more energetic round of applause? A very warm welcome to you, sir. We now welcome Mr. Anil Rajput, Chairperson, Advisory Council, Illness to Wellness Foundation. A hearty welcome to you, sir. And now let's welcome Padma Shri Dr. Harsh Mahajan, Mentor, FICCI Health Sector and Founder and Chairman, Mahajan Imaging Labs. Once again, a very warm and hearty welcome to the distinguished dignitaries on the stage. And now, as a token of appreciation and gesture of warmth, we'll present a bouquet to our esteemed and distinguished guest. May I request Mr. Anil Rajput, sir, to please step forward and welcome Mr. Rajesh Bhushan, former Secretary, Ministry of Health and Family Welfare, Government of India, and Chairperson, Governing Council, Illness to Wellness Foundation, by presenting a floral bouquet. Once again, a very warm welcome to you, sir. I now request Mr. Rajput to please welcome Dr. G.C. Khilnani, Member Advisory Council, Illness to Wellness Foundation, Chairman, PSRI Institute of Pulmonary Critical Care and Sleep Medicine, PSRI Hospital, New Delhi. We now welcome Mr. Rajput to please welcome Dr. Professor Daljit Singh, Vice Chairman and HOD, Neurosurgery and Unit Head, Neurointervention, Max Smart Super Speciality Hospital, Saket. And Mr. Rajput to now welcome Padma Shri Dr. Harsh Mahajan, mentor FICCI Health Sector and founder and chairman Mahajan Imaging and Labs. Thank you very much, dignitaries. Your presence today brings great strength and inspiration to our conference. Once again, a very good morning, ladies and gentlemen. A very warm welcome on behalf of Illness to Wellness Foundation to the Illness to Wellness Conference on impact of air pollution on health and preventive measures. Air pollution, as all of us know, has emerged as one of the most serious public health challenges of our times, impacting not just our environment, but also every stage of human life. Today's conference brings together eminent medical experts, policy makers, and thought leaders to deliberate on this critical issue and explore preventive pathways from illness to wellness. And now to formally open the proceedings, may I invite Mr. Anil Rajput to deliver the welcome address and set the tone for today's proceedings. Can we please welcome him on the dais with a warm round of applause?
Mr. Rajesh Bhushan, former Secretary, Ministry of Health and Family Welfare, Government of India, and Chairperson, Governing Council, Illness to Wellness Foundation. Dr. G.C. Khildani, Member Advisory Council, Illness to Wellness Foundation, and Chairman, Institute of Pulmonary Critical Care and Sleep Medicine, PSRI Hospital. Dr. Harsh Mahajan, mentor, FICCI Health Sector, and founder and chairman, Mahajan Imaging Labs. Dr. Diljit Singh, vice chairman, HOD, Neurosurgery and Unit Head, Neurointervention, Max Smart Super Specialty Hospital, Saket. Distinguished guests, friends from media, ladies and gentlemen, good morning. It is my privilege to welcome you to this conference on impact of air pollution on health and preventive measures, organized by Illness to Wellness Foundation. Your presence reflects a shared concern for one of the most pressing challenges of our time, one that affects our health, our environment, our cities, and the well-being of future generations. Our Veda reminds us that air, Vayu, is the source of life. Pure air sustains our health, strength, and intellect, while polluted air brings disease and suffering. Today, this ancient wisdom resonates more strongly than ever, as countless people confront the harsh and very real consequences of air pollution in our daily lives. For communities across the world, air pollution is no longer merely an environmental issue. It has become a daily public health emergency. We often speak of clean water and safe food. Yet, the most essential element for life, clean air, has quietly slipped out of our control. What was once seen as a distant or localized problem is now visible and growing reality, particularly in rapidly urbanizing regions. From deteriorating urban air quality to long-term impact on health and climate, the consequences are wide-ranging and profound. The global picture is deeply concerning. According to the World Health Organization, nearly 99% of world's population breathes air that exceeds recommended guideline limits. with low and middle income countries bearing the highest burden. In India, the situation is even more stark. World Bank data shows that air pollution levels in our country are amongst the highest in the world, posing a serious threat not only to public health but also to economic growth. All 1.4 billion Indians are exposed to unhealthy level of ambient 2.4 pm. The most harmful air pollutant. In 2019 alone, an estimated 1.67 million deaths in India were attributable to air pollution, accounting for nearly 18% of all deaths. Millions more, especially children and elderly, continue to live with chronic respiratory and cardiovascular illnesses. The consequences extend far beyond health. The economic burden is enormous. Lost productivity due to pollution-related illness and premature deaths accounted to $36.8 billion in 19, which was about 1.3% of India's GDP. These figures make it clear that air pollution is not just a health or environmental concern. It is a critical development challenge demanding urgent and sustained action. And yet, there is a reason for optimism. Across the world, cities and countries have demonstrated that cleaner air is achievable. Stricter emission standards, cleaner fuels, electric and hybrid vehicles, reliable public transport, improved industrial technologies, and robust air quality monitoring have delivered measurable results. Cities such as London and Beijing, once synonymous with severe air pollution, show what sustained actions can achieve. London addressed traffic pollution through congestion charging and the ultra-low emission zones, while strengthening public transport and non-motorized mobility. Beijing adopted even tougher measures, such as closing polluting power plants, relocating high-emission industries, enforcing strict vehicle controls, and rapidly expanding electric mobility. Other cities such as Paris, Berlin, and Mexico City have followed similar integrated approaches, demonstrating that air pollution controls work best when transport, energy, industry, and urban planning move together, backed by strong enforcement and public participation. These experiences underline a key lesson. The real challenge lies not in intent, but in implementation. Progress requires long-term strategies, consistent execution, and sustained commitment. Effective prevention also depends on continuous monitoring, reliable data, and evidence-based decision-making. It requires rethinking how we design and move within our cities, prioritizing public transport, cleaner mobility, green spaces, and urban planning that supports healthier living. In this context, the Government of India's National Clean Air Program, launched in 2019, is a significant step forward By targeting 131 cities across 24 states, NCAP reflects a strategic and a long-term approach to improving air quality. Complementary measures such as Bharat stage emission norms, promotion of electric vehicles, expansion of public transport, efforts to curb crop residue burning, better waste management, and increase urban green cover are all important steps. Yet, much more remains to be done. Crucially, air pollution cannot be addressed in isolation. It is closely linked to policies on energy, transport, climate, agriculture, trade, biodiversity, and most importantly, urban development. Only by recognizing and addressing these interconnections can we achieve lasting improvements. The Illness to Wellness Foundation is committed to building awareness on this issue and has been driving engagement through conferences, outreach programs, and social media initiatives. Over the past 2 years, we have organized school drawing competitions involving more than 15,000 students on the theme, Impact of Air Pollution on Health and Solutions. The creativity and insight reflected in their work was deeply encouraging and reinforced the importance of early awareness and education. Friends, today's conference offers a vital platform to share experiences, exchange ideas, and learn from the expertise of eminent doctors and practitioners. I am confident that the discussions ahead will inform, inspire, and motivate action at individual, community, and policy levels. Let us engage actively and leave with insights that help us move closer to a future where every breath sustains life rather than endangers it. I once again welcome you all and wish you a productive and enriching session. Thank you. Jai Hind.
Thank you, sir, for your insightful opening remarks. May I now invite Dr. Professor Daljit Singh to address the August gathering. Can we please welcome him on the dais?
Good morning. First of all, I sincerely thank Illness and Wellness Foundation for inviting me, ITC for considering my name worth for such a meeting. I have been in my life a professor of neurosurgery at GB Pant Hospital, served almost 35 years teaching the students. So, dignitaries on the dais, familiar and unfamiliar faces in the audience, my talk is going to be more of an academic talk related to the topic which pertains to me was CNS, stroke and pollution. I prepared this talk thinking that there will be some who would be benefited certainly with the idea about stroke and whether there is a linkage between pollution and the stroke. Okay. So bear with me for next few minutes. Currently, I am Vice Chairman at Max Smart Super Speciality Hospital, Saket. You know, for the last 2-3 days, I was reading the newspapers regularly, the coverages which had been coming, and there are a lot of ripples being created regarding air pollutions. And I think many of us are in a habit of flipping the pages in the early hours. So it is there, obviously there, it comes every year, and it will continue for many more years to come. And when I was going through those pages for a couple of days back, Nikla dam bin piye phuk dali 40 cigarette, it is true. Okay, admissions in OPDs and ICUs are increasing, absolutely true. Then Safdarjung visibility stops to 0, flights delayed. Many of you must have missed the flights because of the pollutions, fog and smog, those things are happening every day. And also I was noticing that every day the air quality indices in various parts of Delhi are being monitored and shown, and it is fluctuating from one place to another place seriously, all are seriously level, as if there is a contest for the worst day and the worst place in Delhi every day. So it changes from one spot to another spot, and I was thinking which is the best place to live in Delhi, whether we should live in Delhi or we should quit Delhi or we should be putting mask on our face round the clock. And all these things are happening every day. While I was going through the stroke as my subject, some statistics have been quoted by Mr. Rajput, and I think these statistics are just a number because it varies from one publication to another publication. Largely, each one of them, keeping beside the percentage and the number, are pointing toward the alarming rise of the stroke cases attributed to the pollutions, and these are some of the figures which you people can see and understand yourself. Stroke, red line crossing, even the commonly known respiratory system and ischemic heart diseases, that's very, very alarming. So what is stroke? It's basically impairment of the function of the brain, either by stoppage of the blood flow to the brain or excessive blood flow. And we call it to two categories, ischemic and hemorrhagic. So ischemic means when the blood is not flowing into the brain, and hemorrhagic, there is a bleeding in the brain, and both can present with the different symptoms and sign. And that is ischemic, we call as brain attack, something similar to heart attack. So to simplify, if you say that's a blood vessel, it ruptures, it produces blood in the brain, and on the image on my left, there's an obstruction to the flow inside the blood vessel. It can be artery or a vein. When there is a rupture, we see that white spot which is visible over there, and when there is no flow, it becomes black. That is how a doctor, as a neurologist, physician or a neurosurgeon, will diagnose. Presentations are severe headache, seizures, loss of consciousness, paralysis of limb, which most of you may be familiar with, but there are warning signs. And this is called B fast. And I have deliberately kept it because each one of you should be familiar with this. And this B stands for impaired balance, E is some blurring of the vision, F is some facial deviation, A is drifting of the arms, S is slurring of the speech, and time is precious. Now, this is a campaign all over the world which says that each one of you should be familiar with this Be Fast acronym. And if you notice anyone in the family, rush to the hospital because it may progress to irreversible damage. You have a window period of 6 hours to 12 hours where a lot can be done to save the part of the body as well as life of the patient, if you take them to a center which is well equipped to manage stroke. Now, we all have been reading, teaching since the last many decades high risk factor for the stroke, and we all know hypertension, diabetes, smoking, lipid profile, homocysteine level raise, some autoimmune disorders, these are listed. Now rises is pollution a new risk factor for the stroke? And that is why my objective is to deliver a talk over here. While I was searching the material all over, I found, as mentioned by Mr. Rajput, only 17% of the global cities are having safe air in 2024. He counted 99% are not getting, maybe citing the figure of 2025. And India was number 5, the worst was Chad. This is statistics of 2024. just implying that it is becoming a global problem all over the world. It does not restrict to any city, and one or other way, every country is becoming affected. If I go through annual daily PM25 exposure 2019, you can make out the zone of India was absolutely red, toward the much more higher side than the normal recommended. And the risk of cerebrovascular disease, that's because the brain involved, that's a stroke in a way, due to air pollution has been put in this figure. India is dark color and matching somewhere within African countries. So this is the zone where the stroke cases are emerging because of the pollution in the high risk area. And similar trends are being observed between 2022 to 24. The dark zones are the areas where the stroke risk are been increasing. Now, just for those who are not familiar, WHO has shown countries like Europe, Russia, North America is having a range of 10 to 25 microgram per meter square density of the pollutant. South America, Africa and Middle East has between 10 to 50, and Asian subcontinent is more than 50. Now that's a 50, but when I read it is coming to figure of 200, 300, 400 air quality indices. Mind boggling. Sometimes I wonder how come we are living in Auschwitz chamber kind of a situation of World War I and II. So keeping in that mind, World Environment Day 2019 directed, United Nations directed to have the policies for the safe air action plans. And as mentioned, the stroke is much more common in low and middle income countries, and this has been attributed to rapid industrialization. No rocket science, it is expected, it is going to go worse. Source of pollutant, you all know, need not go to that. It can be domestic to industry. Many a time we just put onus to various industries and the vehicle pollutions, but believe me, domestic bio waste and domestic things are definitely adding to significant number to the pollution than we actually believe in, subjected to good studies on that. So in-house exposure, out-house exposure, we used to believe that stay home and that will be a better way of avoiding. Maybe no longer true. When you have a high density of pollution in a zone, whether you are outside or whether you are inside the house, I think you are equally exposed. Maybe the duration of exposure and the density you inhale is much more while you are in denser area, but I think when you are inside a house for a longer period of time, it's going to have a similar effect if we are living in those zones. That is what my understanding had been. You all know they can be solid, liquid, gaseous, mixed kind of pollutant agents, and they have been classified into different sizes. Some of these you will be familiar with. Very small, medium size, large size. Smaller is the size. They may permeate from the lungs, from the alveoli to the blood vessels, and they may go into the brain or the various other parts of the body. This is how the pollution is affecting almost each and every organ of the body, rather than the only respiratory system, which was initially believed it to be. Now, air quality parameters, all the time I see brown, red, dark brown, and this is very, very disturbing. And I think 0 to 50 is hardly any days in India when we get to see such a good air quality, particularly in Delhi and adjacent NCR zone. Compositions, the oxide of nitrogen, sulfur, carbon monoxide, ozone, volatile organic compound, solid compound. There is a huge list, which one is more fatal, which one is more irritant. That, to my understanding, is still a matter of debate and still a matter of study, which is required a large scale longitudinal studies at a multiple level to blame or pinpoint one single agent which would be causing maximum amount of the damage. These are mentioned as microgram per meter square as density or part per billion for the gases. This is how they are measured. Now, interestingly, and I think Mr. Rajput also did touch upon, there is a variation in the concentration of the pollutant every day. and that has a very important bearing in the genesis of the stroke. Like for example, I was reading sunlight forms ozone, and that forms in the sun high temperature, warm conditions, and between 12 noon to 9 p.m. there is a high level of ozone in the atmosphere. And traffic related soot, they comes somewhere about the same time. And I was reading one of the studies in Africa which documented that PM 2.5, they can travel up to 100 kilometers from one place to another place. So it's not just one zone. Though it may get diluted, the effect may be into miles away from where the source of origin has been there. Organ affected, I just said lungs is not the only privileged organ, maybe it is the conduit for various organ to be affected, and I think you have now understood. Brain on the other hand, we have now mounting evidences which are coming up that Alzheimer's disease, dementia, Parkinsonism, headache, confusion, impaired memory, impaired performance, fatigueness, and they can all be because of the pollutions. Now here I come to something interesting. Many of you would be doctors, some of you would be neurologists also. In my life, I have a 40-year experience of medicine, and we used to see the number of stroke cases rising in the month of November, December, January, and we always attributed it to cold weather. ठंड बढ़ गई है, सर्दी आ गई है, stroke cases आ रहे थे, and we were getting hemorrhagic stroke and as well as ischemic stroke. And please go through this graph of maximum pollution also matches with these months, October, November, December, January. So cold season is not only alone factor for the producing of high risk of the stroke, there is an added pollution which is compounding the effect of pollution onto the stroke. And there cannot be better evidence than this in itself, which speaks volume in itself that yes, the pollution rise has a direct relationship with the occurrence of the stroke. Now, then I searched, is there any scientific evidence? And I found there are references. Somebody says holiday season is a stroke season. People have reported December month, maximum stroke. Seasonal and monthly variations of the stroke and its subtype in North Indian population, again commented upon that it is the winter months which is producing more stroke, and there are more and more studies which are emerging. Now the correlation between the high level of pollution and the season is becoming more and more evident. Now what are the determinant of the risk of pollution stroke? Literature says pre-existing cardiac or pulmonary condition, it's very simple, higher the age, gender, diabetes mellitus, and of course the density of the pollution, exposure period, and the composition also have a relationship with the stroke. And there is one study in China which says the indoor coal fumes have been associated as an independent risk factor for both stroke as well as heart disease. And that's the reason China stopped all kinds of biofuels to be used at home, particularly coal. Now what is the difference between the long term and the short term exposure? Now I was trying to analyze this data and I was reading more and more about, and it says that there is no large difference between in terms of production of the stroke is concerned, maybe other conditions are this. But then what was important was duration of exposure, and it was mind boggling when I went through this data. It says people were admitted with the stroke in various parts of the world with the 1 day prior exposure to the high density of the pollution, somewhere 3 to 5 days prior to the admission. Meaning thereby a short-term exposure can result in the stroke genesis. And these data are very, very disturbing. If 1 day is bad in your life, you stand in a risk of having the stroke, at least as per the scientific literature which was I able to generate. And it also says that rise of both PM 2.5 and PM 10 together are associated with not only high risk of stroke, there is high mortality associated with the stroke also. there are more likely to be death because of the stroke if there is a more denser density of that. I personally feel the short-term exposures can result more in eye problems and respiratory problems than the CNS problems. Then I searched scientific evidence, is there at publications, and there are a number of them, full of them, and I listed some of them for you. It says ischemic stroke and hemorrhagic stroke, ischemic stroke and hemorrhagic stroke, and all these are pointing out that PM10, PM2.5, nitrous oxide, sulfur dioxide, oxygen, all this may add to the development of the stroke, and these have been epidemiological studies which are confirming. Even the gases evidence, there are various kinds of gases, nitric oxide, carbon monoxide, sulfur dioxide, not only solid, the gases are also producing similar kind of a result. And is there any quantity which is more harmful than the quality alone? So largely people have talked about, forget about the quantity of mild, moderate, severe or good, bad and all. Every 10 microgram per meter square increase from the base level where your level is dangerous. Suppose it was 30, next day it is 40. Although it is falling into the range of normal level, it's still bad. If it is 300, it becomes 310, it's still bad. So this doesn't live in the assumption that a value of 30 to 50 is good. I mean, these papers are saying a rise of 10 microgram per meter square, even if you are in a good range, is bad for that zone in order to produce the stroke. And that was also an interesting observation which in terms of scientific analysis I noticed while I was preparing for this talk. So all these quantitative references, qualitative references are existing in the literature for both solid as well as gaseous element which are talking for generation of the stroke. Now also there was an important, the risk is more pronounced in the countries where the main air pollution level and daily variations are high, often concerning the low and middle income group. That's exactly what I was trying to say. If there are daily variation, we feel very happy if it is high or it is low, I mean that is where it is. So I think we are having the enough evidences now to support that the stroke is there and pollution is becoming an important risk factor, and of course there is a time for us to be sure about. So I think mechanism of stroke, I'm not going to go details to conclude. I'll say that alarming trends of the rising air pollutions has triggered a new era of research. Evidences are emerging that air pollution is a definite risk factor for the stroke genesis and outcome. Duration of exposures that result in the strokes need more evaluation. However, reports are scary that even one day of exposure can add to a significant risk. Society needs to introspect. Scientists need to work more and more on this, and the government has to act faster to be able to come to some reasonable conclusion. Thank you so much, ladies and gentlemen.
Thank you very much, sir, for that enlightening address. May I now invite Dr. G.C. Kalnani, sir, to deliver his special address. Can we please welcome him on the dais?
Good morning, ladies and gentlemen. At the outset, giving all the credit to Mr. Anil Rajput for spearheading this illness to wellness program, and I've been, thank you very much for making me part of. I have given it a title of air pollution and health as a man-made emergency, and I'll prove it in the next 10 to 15 minutes. And my previous speakers have made my job easier by showing all these things. You know, what you see, India Gate, and Delhi celebrated Diwali with crackers, and we had expected results after that. And the Chicago study, which came in August 2023, it showed the lifespan of Indians is reduced by 5.3 years and Delhiites by 12 years. Interestingly, when the China took it on a war footing, their life expectancy have increased by 2.2 years. So it's not that it's not undoable, and of course we know all this. Why this man-made tragedy in India? That's the question that I'll try to answer. So you have to look at, we breathe 10,000 liters of air every day, and with that what pollutants go in is important. Where does it come from? We have been blaming Parali, but this year it has been proven that more than 50% air pollutants have come from traffic emissions. And California, which had similar air pollution 100 years ago, in 100 years their number of cars went up by 10 times, their pollutant level went down by 10 times. This is only because of the excellent engine quality and fuel quality, not that they don't have traffic snares. So transportation costs 57%, and of course industries and political parali and indoor air pollution Dr. Daljit has spoken about. We know that 4% of the pollution comes from municipal waste burning, which nobody is looking at. It's absolutely something which is doable. Now, how does it, Dr. Daljit said that lung is a conduit, sir, but it's not a conduit. It is the one which is affected. So there are 6 air pollutants which are there. I'll have to go a little faster. And AQI that you are reading every day, it is made of ozone, particulate matter, sulfur, carbon monoxide and nitrogen oxide. And this was made by a committee by Ministry of Environment. I was part of that committee. But is there anything beyond visible pollution? And that is important. That are nanoparticles. That is particles which are the size of less than 0.1, which actually cross the alveoli, go into the bloodstream and cause all the havoc by reducing our life expectancy. Of course, volatile hydrocarbons, and of course nanoplastics. And there has been study conducted in Delhi that how does it affect our health, from birth defects to chronic bronchitis to respiratory illness, heart attacks. I don't think we need to talk by the paucity of time. But the gynecologist is here, and we know that even when the fetus is there, it gets affected. There's a high incidence of hypertension and neonatal deaths, and today, like me, if you tell somebody that you have got sore throat, headache, your nose is running, or you have tightness in the chest, or you are getting breathless in the night, you will never derive any sympathy from anybody, because everybody will say in Delhi, I have the same thing. But the lung cancer, which is number 1 cause of cancer deaths. When I was studying almost 4 decades ago, if somebody was not smoking, we never considered lung cancer seriously as the cause of his respiratory illness. But today, 50% of lung cancers in India are occurring in non-smokers. And where does it come from? It comes from, majority is coming from air pollution. So, and 40 years back, when if you talked about a nebulizer, people didn't know what is a nebulizer, even if they had children. And today every household, if they have a children or elderly, have got nebulization. And of course brain has been talked about. And every part of cancer can be, every organ cancer can be caused by this. And of course children and elderly are worst affected. So this is important. This pyramid is extremely important because we are talking about mortality, 1.7 million deaths every year. But there are a large number of people who have no symptoms. They have subclinical effects. Some have symptoms. There is decline in lung function, which is well documented. There are hospital visits, emergency visits, and death. It depends upon where you are. If you are living in Delhi, you may be here, but I am telling you from a personal experience that a lot of ICU admissions are there. I being a pulmonologist and intensivist, and we all were amazed to see that you give antibiotics, you give steroids, patients are not getting better and they are dying. And that is what happened in the London smog in 1952 when 12,000 people died. Now, quickly coming to the what can be done. What are the safeguards? Can something be done? First and foremost, please do not go for early morning walks when the smog is there. When you exercise, your intake of air is 5 times, your nasal filter is bypass, you breathe through the mouth, the whole pollutant go into your respiratory system and your blood. And if you have to go, you go whenever there is sunshine, and those who are retired can afford to go, can do that. But always use a mask, N99 or N95 mask. N99 is not very easily available. You do feel claustrophobic in the beginning, but you get used to it. Like in COVID time, we use PPE and mask for almost 8 hours, 10 hours, 12 hours, and we got used to it. But there is evidence, scientific evidence, which culminated during COVID, that there is no drop in oxygen when you wear a mask and do on exercise. Everybody is using air purifier except my home. This is because, being an expert committee member of the WHO, I kept fighting with them. They say there is no evidence that air purifier help in improving the health outcome. I am not saying do not use air purifier, but don't be under the impression that air purifier is doing everything. And there are certain norms to use. Your air purifier must have a HEPA filter and which absorbs air, absorbs gaseous substances, but air purifier should be on all the time, and it should not be used by air conditioner, that you enter the room and then you put on the AC and like air purifier, and your room should be completely closed. And you must have seen, the moment you open the room for 30 seconds, your PM 2.5 goes up. And finally, it does not stop nanoparticles. It does not stop so many of gases. So don't be under the impression just because you have air purifier at home, everything is fine. No, everything is not fine. But who should use air purifier? The elderly people, super elderly, those who have chronic lung disease or heart disease, those who can afford to be at home. And then of course filters have to be replaced. And there are some measures of air purifiers which are known. They do produce ozone. And how much does it causes harm, we do not know. Now, can something be done? That was on an individual level. That is the last part of my couple of minutes I will take. And there was a elegant study conducted by these two eminent scientists. They are not doctors. They are civil engineers from IIT Kanpur, namely Dr. Mukesh Sharma, who is my colleague. He is also a member of WHO committee, and Dr. Dikshit. And they conducted a systematic study in 6 centers in Delhi. And that they said what can be done. If you change all the vehicles to BS6 and change the engines and use hybrid vehicles and electrical vehicles, the percent improvement in AQI is 50 points. That is 50% of the pollution can be reduced. If you regulate the construction, now it's very easy for grab 4, grab 3, construction stops. But is that a solution? Can you stop the progress? So these scientists who themselves are civil engineers, the construction site air pollution norms are there. If you follow that, you reduce the air pollution. There are 9,000 tandoors in this city which are run on coal and wood. They should be converted in the electric this thing, and that reduces the AQI by 80.56 points. Domestic cooking and LPG in all the houses, a lot have been done. And of course, construction and demolition. There are methods of doing it which can improve. I have to go a little faster. We all have seen trucks moving around with Badarpur and all those things, emitting everything. So if you cover them all, then 50% of that air pollution comes down. 4% pollution comes from municipal waste burning, which can be perfectly managed and it will come to zero. And of course, road and soil dust. These engineers said that if the roads are vacuum cleaned 4 times in a month, only 4 times in a month, that, and this is all sciences, it reduces the air pollution by 70 points. And of course, the power plants. All the power plants around Delhi in 3-kilometer radius are run by coal. Only there is one small nuclear power plant. Now they produce a lot of sulfur dioxide and nitric oxide, which are the major harmful substances. Now there are methods that engineers have suggested that you can de-SOx and denox. But for that you have to change and use the coal. But for that you have to change all the machines which produce, and it requires a lot of money. Now it depends where the government wants to spend money. The air pollution in Delhi is not produced in Delhi. A lot of it comes from, depends upon the wind. It comes from north side, it also comes from 300 kilometers all around Delhi from these power plants. 90% of this can be reduced by desoxing and denoxing. And this is what science is. And of course the biomass burning is there. We know about the parali. Finally, we all know this is the air pollution. In May, June, July, August, September, it is 75, 72, this is AQI. Then it goes on and then it comes down. What is the solution? So, Bhakt Kabir, he said, एक दोहा जो हम सब ने आजकल शायद पढ़ाते नहीं है दोहा, कहते हैं दुख में सुमरन सक करे सुख में करे न कोई, जो सुख में सुमरन करे तो दुख का एको है. If you want to prevent adverse effect of air pollution, you have to act here, not here. Every time Diwali comes, we start shouting and screaming. Nothing happens. Today also nothing has happened. There are a lot of sprinklers you see on the roadside. Lot of them. The Delhi government is doing a lot in a way. But is it helping? No, it will not help. You have to act round the year. The father of the nation, he said, the difference between what we do and what we are capable of doing would suffice to solve most of the world's problem, and that actually applies very eminently to the air pollution. Thank you very much.
Thank you very much, sir, for sharing your valuable perspective with us. And ladies and gentlemen, it is now my privilege to invite Mr. Rajesh Bhushan to deliver the keynote address. Let's extend a very warm welcome to him.
Mr. Anil Rajput, Chairperson Advisory Council, Illness to Wellness Foundation, Dr. G.C. Khilnani, Member Advisory Council, Illness to Wellness Foundation. He is also the Chairman of PSRI Institute of Pulmonary Critical Care and Sleep Medicine, New Delhi. Dr. Professor Daljit Singh, Vice Chairman and HOD Neurosurgery, Max Super Speciality Hospital Saket, Dr. Harsh Mahajan, who's mentor of FICCI Health Sector and founder and chairman of Mahajan Imaging and Labs. Ladies and gentlemen, it's indeed a pleasure to be here to interact with you on this whole theme of air pollution and health and preventive measures. This whole issue has broadly two aspects, and my previous speakers have actually touched on them. One aspect is the technical engineering aspect of pollution, why we do not have clean air, and what contributes to us not having clean air, and what can be done to prevent such pollutants so that we do have clean air. So that's the technical and engineering aspect. Then there is the other aspect, which is the public health aspect of what does a non-clean air do to us, the kind of disabilities it brings about or it triggers. Dr. Professor Daljit Singh referred to stroke. Dr. Khilnani referred to multiple disabilities. You see, what we need to understand is that this is a critically important issue from the point of view of public health. There is this concept of disability adjusted life years, which in very broad and simple terms means that if my average life expectancy is 70 years, and if I am, say, living in Delhi or Kanpur or Noida or Gurugram, which are heavily polluted, then I would be suffering from or would have the potential to suffer from multiple disabilities. And those disabilities would reduce my ability to be mobile, my ability to earn, my ability to contribute to the local and the national economy, and it would take away from my productive life years. So technically, on paper, my average life expectancy is 70 years, but in reality, I am living only for 50 years or maybe 55 years. That is the whole concept of disability adjusted life years, and this is what is happening to all of us. So therefore, we cannot say, ye meri problem nahi hai, let the government do something. Or the government cannot say, we are doing everything, but people do not listen to us. It's a collective problem. And today's day-long deliberation are more on the public health aspect. For example, there's a thematic session on its invisible impact on health, metabolic disorders. Then there is mental wellness and neuro risks that pollution induces. Then child health, or to put it more widely, maternal and child health and the impact of pollution on it. So therefore, what we need to understand is that are the government and the private sector in the sphere of public health working together to tackle pollution, particularly air pollution induced disabilities. That should be the focus. The first aspect of why pollution happens, what are the pollutants, how do we curb them, is probably a discussion for another day. But given the fact that there is pollution, an intense level of pollution in the air in certain months of the year, and it does produce different kind of disabilities, given that scenario, what is it that government and the private sector together can do? And that brings me to the question of primary health care, because that is the cutting edge level of finding solutions. When we live in a metropolitan city like Delhi, I was born, brought up, educated in Delhi, but we are a country of 140 crore people. Majority of our population lives in villages in tier 2, tier 3 cities. They do not go at the first instance of a ailment to a tertiary healthcare facility. हम जाते हैं एम्स न्यू दिल्ली या अपोलो या मैक्स या फोर्टिस at the drop of a hat, at least those who can afford it. But in the village or in a tier 3 town, where would they go? They would go to a sub-center or to a primary health center or to a private doctor's clinic. So what is happening at that primary health care level to screen, to identify early signs of pollution-induced ailments? That is something that we should be deliberating on. And if nothing is happening, we should have a plan, both as government as well as private sector. You have FICCI, we have Dr. Mahajan here, you have CII, you have other trade bodies where not only hospital chains but also pathology chains and other health facilities are members. So they should be deliberating that what should be done at the primary healthcare facility level. Because only when you identify the problem in its health problem, in its initial phases, will you be able to refer those people for treatment, and then someone would have to ensure that adherence to that treatment protocol is done, and only then you would be addressing this whole problem of disability adjusted life years. So that is one issue that I wanted to highlight today. The second issue that I wanted to highlight was that as a nation, we are slightly less sensitive to these public health challenges. For example, even if we have to do errands or works which involve traveling over short distances, we prefer taking out our vehicle or motorcycle or scooter, whatever we have, and then doing that work. Little do we realize that our vehicles, whenever we purchase them, most of them do not adhere to the evolving pollution control norms. Let me concretize this. 2 days ago, State Government of New Delhi, that is GNCTD, they said that any private vehicle which is less than Bharat Standard 6 and is registered outside, that is, it does not have a Delhi number plate, would not be allowed to enter Delhi, which is very logical, understandable, because they do not adhere to pollution standards. But what about vehicles which are in Delhi? How many of us sitting in this room, and we are a privileged lot, how many of us own BS4, BS5 vehicles? What have we done about it? Nothing. Because it has not impacted me. So therefore, I would do nothing. This is exactly the scenario we witnessed when we were combating COVID in this country. Till the first wave, no one was bothered. They said, it's not hitting me, it's not affecting me, it's not affecting my neighbor, it's not affecting my relations. It's happening, maybe it's happening somewhere at a distance. Why should I be bothered? मैं क्यों mask पहनूं? Why should I maintain physical distance? But during the Delta wave or the second wave, when the impact came closer home, when I myself got isolated, or my friends were hospitalized, or my neighbors, some of them died, then I thought that the danger was real. And then suddenly, everyone in the country started wearing masks. Everyone said, please do not go out if there is no essential work to be done outside. Otherwise, you just saunter, let's have a cup of coffee. So, as a nation, as a community, we must realize that there are certain self-restraints that we would have to adhere to. So this was the second point. The first, I have emphasized that action need to be taken at the primary healthcare level. Second, I have emphasized that as a nation, we need to be more responsible. As a community, we need to be more responsible, because we do have people who sweep their dirt away and then burn it right outside their homes. So, responsibility. And third and last is the importance of consultations like this. where you have extremely eminent people. The people who are sitting on the dais are nationally and internationally renowned in their field. So when they tell you that air pollution or increasing levels of pollutants in the air are actually contributing to very serious ailments which may require hospitalization or may result in long periods of inaction or even mortality, then people take these things seriously. Until and unless the domain knowledge experts take center stage, the seriousness of the problem will not percolate down. So this is the third and equally important aspect that Illness to Wellness Foundation hopes to achieve by organizing such interactions. I once again thank the experts as well as ladies and gentlemen. All of you have spared time and have come here, and I hope that such interactions will lead to a positive future for us and our children. Thank you.
Thank you very much, sir, for your insightful and remarkable address. Ladies and gentlemen, we now proceed to the highlight of the morning, that is release of the report Countering Delhi NCR Air Pollution and Aligning Solutions. May I request the dignitaries on the stage to kindly release the report. This report is brought to you by Illness to Wellness Foundation and CII Center of Excellence for Sustainable Development. Requesting Mr. Bhushan to please take the lead in releasing the report. And ladies and gentlemen, with this we release the report, which reflects the collective vision and commitment of Illness to Wellness Foundation towards advancing the journey from illness to wellness. Thank you, dignitaries, for unveiling this important publication. And may I now invite on the dais Padma Shri Dr. Harsh Mahajan to deliver his special address and concluding remarks. Can we please welcome him on the dais?
Thank you very much. Good morning, eminent leaders on the dais, distinguished doctors, respected policymakers, committed activists, concerned citizens, ladies and gentlemen. As we come to the close of this important session, I want to begin with a simple but powerful truth. Air pollution is no longer an environmental issue alone. It is a public health emergency, a social justice concern, and a test really of our collective will. Across Delhi and large parts of North India, and probably in all parts of India, the air we breathe has quietly become one of the most dangerous substances we encounter every day. Unlike contaminated water or unsafe food, polluted air cannot be avoided. It enters our lungs without permission, affects us before we can react, and harms us often before we even realize it. For doctors in the room, and there are so many eminent ones, the consequences are painfully familiar. Rising cases of asthma, chronic obstructive lung disease, heart attacks, strokes, lung cancer, pregnancy complications, impaired child development. All these are no longer abstract statistics. They are faces in our clinics and emergency rooms. Air pollution has become a silent risk factor, worsening almost every chronic disease that we treat. In our own centers at Mahajan Imaging and Labs, we analyzed 5,000 chest CT scans that we did last year for reasons other than pollution. But we found that changes which you normally associate with the elderly in the lungs, we are finding at those in their 20s and 30s. So the danger is already here, and what the future bodes for the younger lot here, one can only imagine. For policymakers, the challenge is equally clear. Air pollution cuts across departments: transport, energy, agriculture, urban planning, health, and of course, finance. It does not respect administrative boundaries or political timelines. It demands coordination, long-term vision, and the courage to take decisions whose benefits may not be immediate, but whose absence will be catastrophic. For activists and civil society, this is a battle for accountability, transparency, and equity. Because the harsh truth is this: the poorest breathe the dirtiest air. Children walking to government schools, construction workers, traffic police, street vendors, and residents of informal settlements carry a far greater burden, even though they actually contribute the least to the problem. And for the general public, this issue is deeply personal. It affects how long we live, how well our children grow, how productive we remain, and how dignified our old age will be. One of the most dangerous myths surrounding air pollution is that it is seasonal, and we've heard that it arrives in winter and disappears in summer. In reality, pollution is a year-round problem, with different sources dominating at different times: vehicular emissions, industrial pollution, construction dust, waste burning, household fuels, and agricultural practices. Crop residue burning may intensify the crisis, but it is not the sole cause. If we focus only on one factor, we risk missing the larger picture, and this has been very well said by the previous speakers. Another myth is that the solution lies only with technology: air purifiers, taller chimneys, or cleaner fuels alone. Technology is important, but air pollution is fundamentally a governance and behavior problem. Without enforcement, urban redesign, public transport, clean energy transitions, and citizen participation, no technology is going to save us. This session has shown us something encouraging. We already know enough to act. We know that cleaner transport reduces pollution and saves lives. We know that strong public transport systems are more effective than private car-centric growth. We know that renewable energy improves both air quality and energy security. We know that better waste management and dust control are achievable with existing tools. And we know very well that early health warnings and surveillance can prevent thousands, if not hundreds of thousands of deaths. What we often lack is not knowledge, but urgency. Air pollution kills silently. It does not provoke the immediate outrage of a disaster, yet it claims more lives than many visible crises combined, COVID-19 included. Because its effects are gradual, we have normalized breathlessness, chronic cough, watery eyes, and reduced stamina as a part of city life. But this is not normal. This is not inevitable. And this is certainly not acceptable. The choices we make in the next few years will determine whether North India, Delhi, becomes a region where clean air is a luxury or a basic right. So, as highlighted, what must we do together? First, we must place health at the center of all air quality policies. Every major policy decision, whether in transport, energy, or urban development, should be evaluated for its health impact. Clean air is not a cost, it is an investment with enormous economic returns. Second, we must strengthen accountability and enforcement. Laws without implementation offer false comfort. Pollution norms must be enforced fairly and consistently without exemptions that undermine public trust. Third, we must empower citizens with information, real-time air quality data without hiding statistics. Clear health advisories and transparent communication can turn passive sufferers into informed participants. Fourth, we must protect the most vulnerable, children, pregnant women, the elderly, and outdoor workers. Clean air shelters, safer school environments, and occupational protections are not privileges. They are bare necessities. And finally, we must remember that individual action and systemic change are not opposites. They are partners. While governments must lead, citizens can support cleaner choices, demand better governance, and resist the temptation to accept pollution as a price of progress. Let us also remember this. Delhi and North India are not alone. Cities across the world, as has already been highlighted, once faced air quality crises as severe as ours, and many overcame them. They did so not through denial or delay, but through determined and sustained action. And as we conclude this session, let us not end the discussion, but make it a commitment from doctors to continue documenting and speaking the truth about health impacts, a commitment from policymakers to act decisively and courageously, a commitment from activists to hold systems accountable without losing hope, and a commitment from citizens at large to demand and protect their right to breathe clean air. Because clean air is not a privilege for the future, it is a responsibility of the present. And it is a promise we owe to our children. And finally, let me take a cue from what Professor Khilnani said and say, बुरा जो देखन मैं चला, बुरा न मिलियो कोई, जब मन झांका आपना, मुझसे बुरा न कोई. So let's not just blame the government or others for this pollution, for the security guard sitting outside your home who's burning fire at night because you didn't give him a heater or warm clothes to wear. Let us also look inside and contribute in fighting this scourge. Thank you very much.
Thank you very much, sir, for your words of wisdom. We'll now present a token of gratitude, respect to our distinguished speakers. May I request Mr. Anil Rajput to kindly present a memento to Mr. Rajesh Bhushan. Let's put our hands together and thank Mr. Rajesh Bhushan for his gracious presence, for sparing his valuable time for us. We now present it to Dr. G.C. Khilnani. Kindly keep the applause going, ladies and gentlemen. Dr. Professor Daljit Singh, sir, to please step forward. Padma Shri Dr. Harsh Mahajan. Let's put our hands together and thank Dr. Mahajan for sharing his expertise with us. I now request the dignitaries to please come together for a group photograph. Thank you very much, ladies and gentlemen. With this, we conclude the inaugural session and will now quickly begin the first session on air pollution's invisible impact on health. We'll quickly prepare our stage for the same. We request you all to kindly remain seated and please switch your phones to silent mode in case you haven't done so far. Our esteemed speakers for the first session are very much present inside the hall and they'll be joining us very shortly. We are starting in next 20 seconds. Maternal and child health concern as well as eye and skin health. Ladies and gentlemen, our stage is all set. We once again request you all to kindly be seated. May we please welcome on stage our esteemed session moderator, Dr. Rajesh Kesri, Member Advisory Council, Illness to Wellness Foundation, and Member National Executive Committee, elect RSSDI. Requesting Dr. Kesri to please join us on stage. Can we extend a very warm welcome to Dr. Kesri? A very warm welcome to you, sir. It is now my privilege to invite our esteemed panelists for this session. We have with us Padma Shri Dr. Malvika Sabarwal, Chief Obstetrician and Gynecologist, Endoscopy Surgery, Jeevan Mala Hospital. Can we please welcome the panelists as they get seated on stage. We also have with us Dr. Manu Madan, Senior Consultant, Respiratory and Sleep Medicine, Medanta, Noida. Dr. Amitabh Yaduvanshi, Head of Cardiology, Holy Family Hospital. Kindly keep the applause going. Dr. Manju Keshri, Senior Consultant, Dermatology, Max Super Speciality Hospital, Patparganj, New Delhi. Once again, a very warm and hearty welcome to our esteemed panelists, and I now hand over the session to Dr. Kesri for further proceedings.
So, first of all, I'm very thankful to Shri Anil Rajputji, because as Dr. Khilnani very rightly mentioned that Anil Rajputji has been spearheading, and he's the person behind the Illness to Wellness Foundation. And even before the foundation took the form that it has taken now, he's been working on issues concerning public health, preventive healthcare activities since more than a decade. I think I'm very lucky to have been a part of these activities. So once again, I would like to welcome you all here on behalf of Illness to Wellness Foundation. And I'm thankful to all my co-panelists and all of you who are sitting here and are a part of this wonderful event. And I would like to start this panel discussion with some references from our ancient texts. So I'd like to quote, Vayurve prana vayurhi lokasya nabhi vayuna hi jagat sarvam cheshtate cha jivati cha. Translating this into Hindi means Vayu hi pran hai, Vayu hi is sansar ka kendra नाभि है, वायु के द्वारा ही संपूर्ण जगत चेष्टा यगति करता है और जीवित रहता है. So I think we all know and understand this. We have seen this and read about this in different Indian texts in our ancient Indian Vedas. Vayu is concerned to be prana, to be our life, the essential, the essence of life, the source of life. And when this essence of life gets polluted, it obviously pollutes our life, our health, it affects our longevity. A lot has been talked about the effects of air pollution, but today we are going to, in this session particularly, we are going to look at some particular aspects and some very important aspects of the air pollution, because there are things that we don't understand. We usually associate air and air pollution with breathing. Most of us do, because that's what we feel. We might feel the irritation in the throat, cough, stinging, burning, but that's not all that is to it. As science progresses, as we have a better understanding of the medical science, of the origin of diseases, which I have seen changing since past a decade or so. We are having better understanding of many problems, and we are having a better understanding of many problems which have increased in the past few years. Dr. Khilani showed a pyramid, and that he showed at the base of the pyramid that there may be some subclinical problems. Now, I'd like to compare that with obesity. There was a point when some people were thinking that there might be a healthy obesity, but then we realized that it is a continuum. Here again, it is the same continuum. Today, we might not be having a problem, but that does not mean that in future we may not have a problem because of air pollution. So let us start the discussion. And to start the discussion, I would first of all go over to you, Dr. Amitabh sir. He's a very eminent physician, cardiologist. Sir, there are a lot of metabolic problems in this country. There's the rising incidence of diabetes, the rising incidence of cardiac diseases. You know, the age of heart attacks is getting earlier. People are getting heart attacks at ages less than 40 years now. So we have been learning that pollution has a great role to play in such diseases. So would you like to enlighten us all about this?
Yeah, thank you, Dr. Kesri, and good morning, everybody. So as you rightly said that pollution is a aspect which is affecting the whole body. And usually it is thought about that pollution probably causes some respiratory infections and respiratory problems only. But as the session itself says, the silent aspects or the hidden aspects of pollution, that's very important. And sometimes people don't directly associate things like obesity, diabetes, or even heart disease directly to pollution. But there are now ample data which explains that pollution, especially the PM 2.5 particulates, they are something that affects the whole body because they are absorbed by the lungs and they can enter the bloodstream. So these PM 2.5 particles are so small that probably it may not be even visible. So although the fog or the smog that you see are predominantly because of the larger particles, these small particles may still be there in the air and you may still think that the air is clean or cleaner, as sometimes happens in between. Once you have a grab 3, grab 4, and then it gradually comes down and suddenly we realize, oh, things are looking good. But if you see the PM 2.5 levels, they don't really change that much, and they are the most important aspect of these so-called non-communicable or metabolic disease, as you mentioned. So heart disease, definitely there is an increase in incidence, and there are two aspects to it. One is the acute effect. So when you see the PM 2.5 levels rising, you see, I'm sure all of us have experienced that the cases of MIs, cases of angina, cases of heart failure, cases of accelerated hypertension, even stroke, they increase when you have these pollutant levels high. Earlier we used to attribute it to temperature, but you can realize that many of the years the temperature may not have dropped that much. But because of the fact that, sometimes along with Diwali, the temperature is not that low, but the particulate matters or the pollution levels have risen, and that actually causes an increase in the number of people coming to the emergency. And we have done a study and we have found that it correlates with the levels of pollutions. Similarly, there is a long-term effect. So chronic exposure to these particles, they cause an inflammation in the body, they cause an inflammation in the blood vessels, they cause plaque deposition and can lead to multiple problems, which includes cardiac diseases, stroke, diabetes, even cancers. So I think it's an important aspect which sometimes we don't, even as doctors, we don't realize the importance. It seems that air pollution is just a nuisance and just a problem for the people who have lung problems. As Dr. Harsh Mahajan said, that we have normalized this fact कि winters में थोड़ा कफ तो होगा ही, थोड़ी आँखों में जलन तो होगी, सीने में जलन, आँखों में तूफान तो होगा ही. But that's not something that is there. It is much deeper and much more sinister than just these irritations.
Thank दैट इज़ ट्रू, वेरी ट्रू कि खाली एयर पोल्यूशन मात्र की वजह से दिल का दौरा पड़ जाए ये हमें महसूस नहीं होता, बट दिस इज़ द ट्रूथ, दिस इज़ द फैक्ट, और हमें ये समझना बहुत ज़रूरी है। डॉक्टर दलजीत ने हमें बहुत अच्छे से दिखाया है कि स्ट्रोक और एयर पोल्यूशन के लेवल्स का कितना गहरा घनिष्ठ संबंध है। सो थैंक यू सो मच सर। We're really honored, Dr. Malika ma'am, that you are together with us here. I think one of the profound effects of air pollution that I personally feel is happening, we are definitely all serving. But how about the young pregnant lady? So what happens when she breathes this air, a young pregnant girl who's going to be mother, and our future generation which is going to come after that?
Thank you so much for the very important question. And I must congratulate Dr. Mr. Anil Rajput to have organized this wonderful session on air pollution, the invisible effects on various medical issues, right from what we've heard in the morning. That was an excellent session by all these stalwarts, concluded very beautifully with Dr. Harsh Mahajan. And he very nicely brought out the whole subject, and he touched everything. And I think Dr. Kesri, so this is so important because today we realize that almost like 99% of the world population is actually breathing polluted air. And out of which I would say that the most vulnerable population is the young pregnant mother and the intrauterine fetus which is growing inside her, and the neonates which have come out at various stages. A young pregnant woman can land up having blood pressures. We know it is much more common. Now there are a lot of studies which have shown that pollution does affect the blood pressure status of the patient, resulting in preeclamptic toxemias of various stages. Then in the right from the first trimester, you will see during pregnancy, the intrauterine growth starts to get affected, and they can have early growth retardation, which are picked up earlier, and they carry on till the time the birth is happening. They will end up having placental abruptio, which means the separation of the placenta from the womb, and hence resulting in a complication of bleeding and having to do a premature birth. Not only placental abruptio, even otherwise you can have a preterm delivery happening because of various inflammation which we've already understood. The PM 2.5 and the one which enters the circulation is going to does affect the placenta, causes inflammation and resulting in premature births. So these are very commonly seen factors today. Then again, we see more depression in such pregnant girls, Even postpartum depression is more, the incidence has gone up in such times, especially in these months when the pollution goes very high. And we have to make sure during our antenatal patients, when they visit us, when they talk about going out, because we do try to restrain the going out and telling them all the advice. But it is so important that this message is given socially to all. And this is one of those things what today is happening here, which should be spread. So this is very important. Now coming to the neonates also get affected. There is growth retardation. There are lung issues which happen. So when the baby is born, they are more prone to having asphyxia. Asphyxia means when the oxygen levels are low, and when the baby will not thrive as much, lungs can be implicated, and they can have various scenarios like stunted growths which can be picked up in the subsequent years as the child is growing. So the baby will be affected, whether it is physically, wherein the lungs are concerned, and also if there is oxygenation deficiency, then the brains also get affected. So these are very sad outcomes, and I think it is very important that we address these issues on a war front. And it's very sad, like we are here in the urban areas, but there are so many other, like you talk of the villages, etc. You have the fossil fuel which is burning day in, day out, whether for cooking or even for heating purposes. Like Dr. Harsh Mahajan so beautifully pointed out, and I thought, yes, that even the chair, you know, the guard who's sitting outside may be just burning it outside our homes in the city, which is so sad, we don't realize. And it is primarily all of us who are responsible for that. And we must realize that the vulnerable population of a pregnant woman and the neonates must be in a secure environment indoors, which have to be, you know, which has not nicely been brought out by the air purifiers, etc., very beautifully by the previous speakers. I think we should all adhere to that. And very nicely pointed out that all the doors and all should be closed, which I think I will add on to my antenatal advice also to my patients, though we talk of air purifiers, but this is something which we did not even realize, that a little bit of opening of the door and there the pollution from outside can just come in. So I think it's very important, and thank you so much for this.
Thank you, ma'am. Thank you. And in fact, this has been a great learning experience for me also. Because even though we generally know and realize, even as a physician, as a doctor, that air pollution causes inflammation, it is not good, it is obviously bad for young mothers also. But the way that you beautifully explained and the specific adverse effects of air pollution on pregnant women, I think all of us sitting out here in the hall would take this message with themselves and would be very careful in their families and with their friends and pass on this message that young mothers have to be very careful and to secure themselves, to try to be in a safe environment, either with air purifiers or I don't know, change the location somehow. So it's really very important. Thank you, ma'am. Dr. Manju, अब हम आपके पास आते हैं. I think skin is one of the biggest exposed organs in the human body, and even though in winters we are wearing lots of clothes, but still there's a big exposure. तो आप संक्षिप्त में बताइए कि हमारे स्किन के साथ क्या होता है when it comes in contact with the pollutants.
See, skin is the largest organ, and it protects all over all organs, and because it's a largest organ and it's a first barrier when it comes with the air. So all the pollutants, they come first contact with the skin. So these pollutants, as they enter, pollutants like PM2.5, smoke, ozone, they enter the pore and they damage skin barrier. So if there is damage in skin barrier, there is sensitivity, redness, dryness, and these pollutants, they basically stimulate free radical damage is there, and they basically they stimulate degradation of elastin, collagen. So there is fine lines, wrinkles, early signs of aging. And these free radicals not only stimulates at the cellular level, and over the skin they stimulate inflammation. And these inflammation, they flare acne, rosacea, and these low grade inflammation leads to pigmentation that we can see later on in later life. And these all problems, they come across in daily routine. So early signs we can see as a flare of acne, rosacea, pigmentation, melasma, and later times we can see as an early signs of aging and sagging. So these are the few changes we can see as a skin.
Thank you, Dr. Manju. I think this is a very, very important session because we are learning about different effects of air pollution, which probably I myself never imagined that they are there. So we are aging much faster. So this is also one of the adverse effects of air pollution, and we can see that on our skin, जैसे Madam ने बताया. So there is one more reason to be more vigilant. I would like to go over to you, Dr. Manu, because you are the hero here today. You are the first point of contact with air. Tell us briefly. So what are the problems that we face with our breathing apparatus with air pollution? Then we'll move on ahead because there's a lot of questions that you'll have to answer.
Thank you, Illness to Wellness Foundation, for inviting me. Thank you, sir, for the question. So to answer that question, we need to understand what is PM 2.5. What does PM mean? What does 2.5 mean? PM means particulate matter of size 2.5 micron. Our hair is 70 microns. So you can imagine the size of that particle. This is such a small particle which enters deep into the lungs. So when we talk about the effects of these particulate matter on the body, as the air, dust particle or the pollution enters, body tries to expel it. So majority of the symptoms are because of that. So when the dust particle enters your nose, it will cause running nose, it will cause a blocked nose, it will have sneezing. All these are attempts to stop that dust particle from going inside. But if still it goes inside your throat, inside your windpipe, this big is the windpipe. Again, body tries to stop it. It does not want this dust particle, this pollution to go inside and damage your body. So it shrinks, it constricts owing to inflammation. This shrinkage causes us symptoms. Not directly the dust particle, it is this shrinkage which will cause shortness of breath, it will cause wheezing sound because the tube is narrow. Whenever air gushes through a narrow tube, it produces sound which we refer to as wheezing. It will cause increased coughing because the dust particle has reached here. You want to cough it out, you want to expel it. And chest tightness. All these symptoms we refer to as asthma. So asthma is nothing but the allergy or the continued exposure of pollution and allergens. If despite that this dust particle enters into the lung, gets deposited into the lung, then it causes multiple infections in the body. It has potential to worsen the lung functions. It makes you susceptible to infections. It makes you susceptible to lung cancers. So it's a whole range of disease it can cause in the lungs, and once it penetrates the blood, as we are discussing, it can affect all the organs of the body. So yeah, it has a potential to affect all organs as well as all diseases in the lungs.
Thank you, that was very nice. So this is what happens, this is what I think we heard in the first session also, that if you complain to anyone today that you're having a sore throat, itching, or running nose, or stinging in your eyes, people won't be surprised because literally everyone is having. Now why you're having, that is the reaction of your body, that is the way your body is reacting to the environment around it. So बहुत सारी तकलीफ हमें इसलिए होती है कि हमारा शरीर इस तरीके से उसको एड्रेस करता है. Now this is something we can feel. We can feel the problem in the throat, we can feel that we have trouble breathing because our body is trying to protect. We have this cough, sputum, because the body is trying to throw out that pollution. But what happens is when this PM 2.5 particle or smaller particles, they actually get absorbed in the bloodstream. और फिर वो खून के साथ साथ सारे शरीर में फैलते हैं. There is no place in our body, हमारे शरीर के अंदर कोई ऐसा organ नहीं है जो उस PM 2.5 पार्टिकल या उससे भी छोटे पार्टिकल्स को एक्सपोज नहीं होता है. तो जब ये पार्टिकल्स हमारे बॉडी के और ऑर्गन्स में जाते हैं, then they cause this damage. We started with metabolic disorders. हम लोग मोटापे की बहुत बात करते हैं और हम लोग अभी हमने सेशन और भी किए हैं इससे पहले कॉन्फ्रेंस में. वी ऑलवेज टॉक अबाउट डाइट एंड लाइफस्टाइल कि प्रॉबेबली हमारा खाना पीना ठीक नहीं है, फिजिकल एक्टिविटी कम है, उसकी वजह से हमारे देश में सबको मोटापा होता है. बट वी एज डॉक्टर्स हैव ऑलवेज सीन सम पीपल who actually have a good lifestyle, who go out for their walks and physical activity, और वो बेचारे 2 रोटी से ज़्यादा कभी उन्होंने खाई नहीं, फिर भी उनका वजन बढ़ रहा है. So as doctors, because we are seeing patients, people who have illness, we always find this gray area that something is missing. And recently with the advent of new drugs, so there has been a lot of talk about obesity. And there we have learned that environmental pollution, air pollution, plays a very important role in causing obesity. तो मोटापे की एक वजह ये एयर पोल्यूशन है, ये सोच के कितनी हैरानी होती है. ऐसे ही मैं रिक्वेस्ट करूँगा डॉक्टर अमिताभ, आप हमें डायबिटीज़ और पोल्यूशन के बारे में बताइए, इनका क्या रिलेशन है.
So, आपने सही बोला, मोटापा and diabetes are something which normally we do not associate with pollution. We call them as metabolic diseases कि खाने पीने के कारण और अपने hormonal imbalance के कारण हो रहा है. But There have been studies which have confirmed that obesity is related to pollution. As you mentioned, the PM 2.5 particles, they go and they affect all organs of the body. So when you talk about obesity, obesity is fat deposition in the cells which are called the adipose cells. So adipose cell is also a you may say harmonically affected organ. So the hormones of the body, they have an effect on the adipose cells. So when you have pollution, these hormonal effects are amplified. So they encourage fat deposition. So that's why obesity occurs. Also, when you talk about diabetes, there are two issues aspect to diabetes. One is less insulin production. But majority of the diabetic patients are because the effect of diabetes on is effect of insulin on the peripheral tissues like the muscles, the liver and all is blunted, which is called as insulin resistance. And it has been found that when you have more air pollution or you are exposed to air pollution, this insulin resistance increases. And this insulin resistance then indirectly cause increase in your blood sugar levels, which is defined as diabetes. This insulin resistance also cause increase in your adipose tissue levels, which is called as obesity. So, and the whole gamut of metabolic syndrome. And as I mentioned earlier, it increases blood pressure, it causes inflammation in the blood vessels, increases chances of plaque formation in the blood. So the whole gamut of metabolic syndrome, which is obesity, diabetes, and heart disease and hypertension, they can all be further worsened by exposure to pollution.
थैंक यू सर। यहाँ पे मैं दो चीज़ें और ऐड करना चाहूँगा कि ये PM 2.5 पार्टिकल डायरेक्टली हमारी पैनक्रियाज को इफ़ेक्ट करते हैं। पैनक्रियाज वो ऑर्गन है जो इंसुलिन बनाते हैं, जिसके बारे में सर ने बात की, चर्चा की कि पैनक्रियाज को इफ़ेक्ट करते हैं और पैनक्रियाज में खास तौर पे जो बीटा सेल हैं जो इंसुलिन बनाते हैं उनको डिस्ट्रॉय करते हैं। सो देयर इज़ अ डिस्ट्रक्शन ऑफ पैनक्रियाटिक बीटा सेल which take place because of this PM 2.5 particles. It has been proven in studies, and this further aggravates the cycle of diabetes. The other thing which happens, which has been talked about, is inflammation. तो inflammation क्या है? अगर simple शब्दों में बोलूँ तो inflammation एक भीमी आँच है, एक समझिए एक लौ है जो हमारे शरीर में जल रही है। वो एक ऐसा प्रोसेस है जिसकी मदद से हम जिंदा रहे हैं अभी तक, क्योंकि कोई बाहर से आक्रमण हमारे शरीर पे होता है किसी कीटाणु का, सो बॉडी with the help of inflammation fights with that. But when it becomes chronic and when it is there when not required, then it starts eating us from inside. So ये जो लौ है, ये जो आँच है, ये हमारे शरीर में जल रही है और इसकी वजह से बहुत सारे ऑर्गन डिस्ट्रॉय हो रहे हैं और इसी की वजह से ये इंसुलिन रेजिस्टेंस पैदा हो रहा है। इंसुलिन बंद तो रही है लेकिन वो काम नहीं कर रही। तो ये बहुत सारी चीज़ें हैं और इसी से एक रिलेटेड फैक्ट है जो मैडम आई वुड लाइक टू कम टू यू। हम सब देखते हैं कि आजकल इनफर्टिलिटी एक प्रॉब्लम हो गई है। IVF सेंटर्स इतने सारे, सब जगह इतने बड़े बड़े बोर्ड लगे हैं कि मैं तो हैरान होता हूँ, कोका कोला के इतने बोर्ड नहीं होंगे जितने IVF सेंटर्स के होते हैं। सो बट व्हाई आई एम टॉकिंग अबाउट, बिकॉज this is a problem in our country. So how is it related to air pollution? Is there any relation?
Thank you for a very pertinent question. Actually, it has been seen and there's been a lot of evidence on that कि air pollution से जो fertility है goes down. A couple who's trying to get pregnant and who's staying in an environment where there is industrial problems and all that air pollution is more, does take longer to conceive. It's a known fact and the studies have shown that. Then also when the young couple is undergoing IVF, उस IVF का भी जो outcome होता है, जैसा कि आपने बोला, it's a fact कि infertility इतनी common हो चुकी है, पर उसके कई और भी reasons हैं besides air pollution, because आजकल कोई भी यंग कपल एक तो शादी समय पे नहीं करेंगे, देर से करेंगे और फिर बोलेंगे अभी तो करना नहीं है बच्चा, और जब करने की नौबत आएगी तब तक ओवेरियन फंक्शन जा चुका होता है। सो दे ऑल नीड टू टेक हेल्प एंड देयरफॉर द IVF सेंटर्स हैव रियली फ्लरिश्ड, देयर इज नो डाउट। बट येट जो IVF का जो आउटकम है, जो वो साइकिल्स लेते हैं, तो वो थोड़ा सा कम हो जाता है बिकॉज ऑफ वेरियस इन्फ्लेमेशंस दैट आर हैपनिंग, बिकॉज ऑफ PM.25, which is going into the blood circulation, causing inflammation, causing a lot of detrimental effect all over the body, including the genital tracts and the ovaries, etc. So it's been seen the IVF outcome going down.
Ma'am, just continuing this conversation, we know that PCOS is also linked with inflammation. So, do you feel or do you think that the air pollution would have something to do with the rising cases of PCOS as well?
See, that's a very important question that you've asked me. In fact, as you were talking of the insulin resistance, I was just thinking, because PCOS is a condition which I will just tell you what I'm sure many of you would be knowing, but still I'll repeat, means polycystic ovarian syndrome. So wherein normally the trend is that a lady has got one uterus, two ovaries, and each ovary, right and left, will form one egg per month. But in a polycystic ovary, there will be multiple eggs which get formed, and none of them really mature. And answering to your question, that whether, I think you're talking of the incidence of PCOS which is rising, anyways which it is rising because of a simple reason that girls, today the social habits are totally changed. Nobody believes in the ghiya, tori, dal, sabzi, khana at home. Everything by the evening is coming through the Zomato. It's all pre-cooked. People are putting on weight, which is an extremely important factor for a polycystic ovarian patient. If you put on weight, you just tell them to reduce even 5% of the weight, they would come out with a better result as far as the infertility goes. And whenever there is a polycystic ovarian morphology, there will be insulin receptors which become insensitive to the insulin that is being produced by the body. So what happens is, a girl who's PCOS will eat one roti, and her friend would be eating 2 or 3 or 4 rotis. They will not put on weight, but a girl who's got PCOS will put on weight because she's not able to metabolize that khana, whatever she's taking. Also, like I mentioned earlier, the wrong eating habits, and also with today, everybody is holding a phone. Nobody likes to exercise. They have shortcuts, so they put on weight. So it's become a vicious cycle. And air pollution, role of air pollution on this forum, I'm not very sure of that. But I'm sure it must be definitely causing some kind of implication, and we should keep it in mind whether the incidence does go. In fact, I'm thinking that maybe in the months when there is more pollution, we might be picking up more cases of this. But any which ways, we are picking up a lot of PCOD problems.
Yes, thank you, ma'am. And I think there are indirect effects also. First of all these chronic metabolic disorders like diabetes, obesity, CAD, to a certain extent, and PCOS. So they don't have a single cause. They have multiple causes. So there are multiple attributable causes to these. There is genetic predisposition, there is weight, physical activity, lifestyle, diet, some diseases, viral infections, different exposures. And अगर एक चीज़ थोड़ी सी बढ़ जाए तो वो पल्ला भारी हो जाता है और बीमारी की तरफ चला जाता है. So I think we should not forget this, that it may not be the single causing agent, but there is definitely some contribution to it.
I'll want to add one more thing. I've seen that the immunity also goes down. Because with air pollution, definitely evidence is there that your immunity does get affected, it goes down. So you're more liable to all these metabolic problems, etc., etc. So
Yes,
which has to be kept in
definitely.
mind, yes.
Thank you so much, ma'am. Dr. Manju, there is a dreaded disease, cancer. Madam just talked about immunity. So with the exposure of the largest organ of our body to these toxic agents, because we've heard since the morning that these are all toxic agents. So is the change in, let's say, cell replication, DNA, can it lead to cancer?
Yeah. First, I'll talk about the inflammation. We were talking about the inflammation. Skin as a defense organ, first organ to come contact with the air. So what happens? These pollutants, they gives low-grade inflammation. So this inflammation basically hinders the local immunity, they suppress the local immunity. So if there is suppress in local immunity, so this basically हैम्पर्स जो भी वहाँ पे जो सेल टर्नओवर होता है, जो सेल की टूट फूट हो जाती है, उनको जो एक मैकेनिज्म होता है हटाने का एंड रिन्यूअल का, वो स्लो हो जाती है. So later on it affects and this cell turnover, this creates the problem later on, and this pollutants, low grade inflammation along with the UV damage, they add, and this all leads to DNA damage. So these can create basically in later on life, they can be precancerous, and it has been seen that these problems they give later on non-melanoma cancers such as squamous cell and basal cell carcinoma, and this becomes more important for the person who are working outdoors and long exposure life. So there are evidences that this can give rise to non-melanoma cancers.
थैंक यू डॉक्टर मंजू. तो हम ये देख रहे हैं कि एयर पोल्यूशन के एक्सपोजर से स्किन कैंसर भी हो सकते हैं. सो दिस इज अ वेरी इंपॉर्टेंट थिंग. मूविंग अहेड टू यू डॉक्टर मानू. So we've talked a lot about the diseases. I'd like to ask you, we've been talking about air purifiers, literally everyone has said. First of all, do they work? Are they useful?
That's actually a tough question to answer. Before me, Dr. Khilnani has already spoken about it briefly. So I'll try to give you an example. Sudden changes in the body are never good in your environment or your body. If I ask in the audience, how many of you bathe with cold water in morning? I see one hand there, couple of there. How many of you bathe with warm water in morning? Yes, majority. If I ask you, how many of you bathe with warm water followed by cold water? So we see barely any hands there. So what do I mean to tell you? Sudden changes are never good. हम इसको हिंदी में बोलते हैं गरम सर्द हो जाएगा. Right? Same thing happens with the body. If you change your environment pretty frequently, you move from a room with air purifier to a room with no air purifiers, it might cause a detrimental effect also. And to answer if it helps, as Dr. Khilnani said, there is only a modest literature which says it might be beneficial. And that too from countries where pollution was low. In the country of ours, we do not have a study which can say that this kind of air pollution, will it work? So that is a question that needs to be answered. And the second part which needs to be answered is, what is the duration in which you need to be inside the air purifier to be effective? Do you want it 24 hours or 4 hours or overnight is enough? So that these questions still need to be answered. So as of now, I recommend my patients air purifier if they are going to stay at home at all times, or if they have underlying heart and lung diseases. For other populations, I say you might try, but try to stay indoors or try to stay in environments of air purifier most of the times if you want its best effect to happen.
So I'll just add that the air purifier has to be HEPA 4. It must have a HEPA 4 filter. Only then it is effective. Okay, so I'll go rapid fire with you. Face mask.
Regarding face masks, yes, face masks are very important, and face masks should be worn. Again, Dr. Khilnani had talked about N95, wearing N95s. So do we know what is N95? What is 95? 95 means it will filter out 95% of particulate matter. So if your denominator is pretty high, like in Delhi, the 5% which is going inside is still going to be high. It will going to filter only 95% of the AQI of 500. Your 5% is still pretty high. So that cannot be the sole solution. Yes, it is going to help you, but that cannot be a sole solution. If you wanted to wear for prolonged periods, I recommend my patients that you should wear the N95 with the valves, so that there is no CO2 rebreathing. So when you exhale out, the CO2 accumulates inside the mask. When you wear it for prolonged periods, not talking about the shorter periods, 1 hour, 2 hours, 3 hours. If you're wearing for prolonged periods, your work is outdoors, then go for the mask, N95 mask with the valves. That can help reducing the CO2 burden in the body, and the oxygen concentration will be better.
So this is a personal question. Now there are portable air purifiers available. One of the faculties on the stage was also wearing. So what are they? How do they help, or do they help if they help?
Again, a burning question, and not a pretty clear-cut answer for that either. Though these air purifiers which we wear in the neck work on the principle of ionization. They'll ionize the particulate matter, make them settle down. But since ionization is happening, it has the potential to form ozone in the environment. So when ozone is formed, it is even more detrimental for the body. And there has been some conflicting data that wearing these ionizers might even affect your heart rate and heart rate variability. So as of now, first of all, if it's safe or not, that is yet to be answered. And secondly, if it would work in this environment, and I am not very sure it will.
A quick question to both of you. We advise all our patients to go for morning walks, that is so good. But considering all this, how good is morning walk?
So, a very good question, and in fact, I make sure to tell my patients, don't go for a morning walk. Definitely not if you are a heart patient, and especially multiple reasons for that. One is obviously pollution, second is the temperature, as Dr. Madan mentioned, sudden change in temperatures. So, whatever warm clothes you wear, sometimes you are not as careful as you need to be, especially in changing weather. So, and that's also a time when, in fact, we did a study where what we call as delta T, so the change in temperature. So it's not the level of temperature. Sometimes the sudden change in temperature increases the chances of heart attack. Yes. That's because you are not very careful. You see the sun in the morning and you go out without a warm clothes, and then in the evening you are exposed to that. So I don't recommend at all morning walks. Walks are important, but in the present scenario where it's a gas chamber, so I would suggest that have a air purifier for whatever it is worth, have it at home, and then do the walking or exercise in the indoor environment only, especially people whom I treat. They are usually elderly heart patients, so I don't really recommend. Especially more importantly, another aspect, there is a traditional view that khana khane ke baad chalna chahiye, and that's all what our elders used to tell us. But for a heart patient, you should take rest after meals. So whatever exercise or walking you have to do it before meals.
Thank you. I'd just like to add one line here that there have been studies which have shown that taking bath in cold water, especially in winters, is not very good and it may lead to stroke. There have been such incidences. Why? Because there's sudden vasoconstriction. खून की नली अचानक सिकुड़ जाती है और उसकी वजह से ब्लड प्रेशर बहुत ज़्यादा बढ़ जाता है और ज़्यादा उम्र और बीमारियां हैं तो वो फट भी सकती है. सो दिस cold bath concept is not very good, especially in the winters.
In fact, it has become a social media trend, so ice bath and all. And in fact, as he was asking the question, there are people who do a warm bath and then suddenly there is a cold bath, and there are people who swear by it. But I'm sure it is not very healthy.
Thank you so much. So all these have been very interesting, but we are running out of time. There's little we can do right now in coming few years, let's say ourselves about pollution, but I'm sure there's always something we can do. मैं अपने मरीजों को ही बोलता हूँ कि खुद से क्या कर सकते हो उसके बारे में सोचो, दुनिया क्या करती है उसके बारे में नहीं. So starting with you, so what advice can you give to your patients or all our audience and listeners? How can we do something ourselves to decrease this pollution?
Well, as Dr. Khilnani said and Dr. Harsh said that पहले खुद को देखना है, as you carefully rightly mentioned. So things that you can do, one is to protect yourself, second is to try to protect the environment. So don't take your vehicles out for small errands. Use an electric vehicle. But there are challenges to that. I myself have an electric vehicle and I have been stuck with a zero battery at least 3 times in the last 1 year. So there are certain things that needs to be addressed to maybe the charging stations have to be more in the city at least. Maybe there can be a kind of a power backup for a electric car where you can plug it and it can at least go to 5 or 10 kilometers in case of an emergency. So things that should be there. Maybe you have an app where it constantly starts alerting you that your battery is low and this is the nearest charging station. So this is something that I personally felt, and that is one of the reason I am afraid of taking my electric.
Thank you. I think these are some things that which are not in our hands. So definitely it's a big challenge. Anything like any specific foods or anything we can advise our patient कि वो 2.5 तो जा ही रहा है अंदर, but if you have this or that, if you drink more water, can change the situation. Any such thing from any of the panel? Anyone in the panel? A quick reply, yes.
Regarding that, there are few plants which have been mentioned, which have the potential to detoxify air a bit. Although they can't remove PM 2.5, but whatever they can, you can try snake plants, money plants, areca palm at home, which can be helpful in removing that. Regarding the foods you eat, there are few foods mentioned in Ayurveda, which have been corroborated with the scientific evidence later, which have antioxidant properties and anti-inflammatory properties, which might be helpful in asthma. So those can be probably implemented here as well, which include dalchini, haldi, kali mirch, clove. These are things which are helpful. Probably you can take a bit of them with warm water every morning, but excess of anything is bad. So do not overdo anything. Probably these are things you can try.
Thank you. You want to say?
Yeah, I was going to, I would like to just add vitamin C to it. I think what he said, dalchini, is extremely good. It's got a lot of immune response, very good effect on immunity. And vitamin C also helps in your growth of immunity. These things should be taken as a rule. And काली मिर्च जो इन्होंने बोला है वो तो बहुत ही अच्छा है जो कि you know, we don't use it in our regular cooking, but it should be put in dal, etc., etc. Even all these things, what I'm saying. India has got excellent spices which can be used to increase immunity. And the biggest message I would like to give to all is that we should spread this knowledge. And I've got these take-home messages by all of the panelists who are speaking, by Dr. Keshi, what you brought forward, and even the earlier speakers. So we must remember not only to keep within ourselves, but we should impart in our own family, with extended family, friends, and the patients.
Very true,
Yeah.
very true.
So I would like to add ginger to the list as well.
With being a member of my RWA and I'm attached to all other parks nearby to my home. So basically we installed compost हमने जो किया है and we collect all vegetable जितने भी उनके होते हैं peels होते हैं हम उनको उसमें डालते हैं and we don't throw outside and हमने encourage किया है सारे हमारे RWAs को not to burn coal and we have given heaters to them and being attached to with all other parks. So what we encourage हमने वहाँ पे एक बड़े बड़े जो एक कंपोस्ट हमने गड्ढे बनाए हैं and जितने भी पार्क का जितना भी उनका कचरा होता है हम उनमें डालते हैं. So not to spread all over, this is also a kind of preventive measure.
So I think this has been really very interesting panel discussion.
I want to reiterate, Banju, आपने बहुत ही प्यारा बात बोली. I think that's the basic duty of all of us in the society, to do it in the community wherever we are living, to segregate the waste and to recycle and do like what Manju has already brought forward.
So I think we have added not only to the medical knowledge about health and awareness, we are also doing a social service, and I hope that I'm sure many of the attendees are already doing this, but those who have not taken up this would further on spread the knowledge and spread these values and this message in their communities, in their societies. So I'm once again very thankful to Illness to Wellness, to Shri Anil Rajput ji, to Mr. Sandeep Jain ji, for inviting us and giving us this opportunity to be amongst you. Thank you so much, and thank you to the
I
panel.
have one thing to add. We haven't talked about role of steam inhalation and saline gargles in daily practice. I have seen it to be pretty effective in my patients who tend to be affected every season. If you tend to practice steam inhalation and saline gargles more frequently, probably you are able to flush out the toxins in a much better way and might be really helpful in your respiratory symptoms.
Thank you very much. That was it.
Thank you so much because you have taken such a deep dive and you have digged up so much of questions. Thank you so much conducting this session very well, and thank you Fikki for organizing such a nice session and the impact of air pollution. One thing most important is actually we never learn from something. COVID-19 ने भगवान ने इतना अच्छा किया, मैं कह रहा हूँ इतिहास में इतना अच्छा काम कभी लाइफ में नहीं हुआ. एयर क्लीन, सब कुछ ठीक हो गया. आपको आई थिंक वी हैव टू टेक लेसन आउट ऑफ कोविड. एक्चुअली आपके रिलेशंस बता दिए, हाउ यू सी क्या कर सकते हो आप. एक चीज़ बड़ी इंपॉर्टेंट है कोविड से कि मैं हिंदी में कहता रहता हूँ, आई ऑलवेज स्पीक कि पहली दफा समाज सत्ता राष्ट्र सत्ता से बड़ी हो गई। लोग बाग भूखे जा रहे थे, लेकिन समाज ने भूखा नहीं मरने दिया, सरकार पे कोई इंजाम नहीं हुआ, कभी एक भी आदमी भूखा नहीं है पूरे कंट्री के। मैं कह सकता हूं, लास्टली मैं कहता हूं कि व्हाट इज द मदर ऑफ दिस ऑल एल्स? व्हाट इज द मदर एक्चुअली? When we go, you see, in Niti Ayog, Amitabh Kanji talked, I had a very, you see, different of opinion. These cities are the growth engines of this country. The government has, you see, come out with a very good, you see, this scheme, smart cities. वाह, 1,000 करोड़ जयपुर के लिए लगा रहे भाई, भरतपुर का रहने वाला हूँ मैं, वहाँ लगा दो ना आप यार, बीमारी खत्म हो जाएंगी, सैटेलाइट टाउन्स बन जाएंगे। 2 tier, 3 tier, you develop these things because excess of everything is very bad actually. आप हिंदू में बड़ा तगड़ा आर्टिकल है, गुड बाय दिल्ली, कब तक करेंगे भैया? आपने इतने बड़े बड़े अट्टालिका बना लिया, गुड बाय दिल्ली, एवरीबडी इज गोइंग टू गोवा। सो द पॉलिसी डिसीजन, ओनली वन पॉलिसी डिसीजन कि भाई 10 लाख पे इसको खत्म कर दो, ठीक है, कैपिटल और कलकत्ता बॉम्बे को छोड़ दो, 10 लाख 15 लाख, कितनी सिटी हो गए? 1 बिलियन कितनी सिटी हैं? दैट इज द मोस्ट डेवलप्ड स्टेट। अरे भाई ये क्या?
So sorry to interrupt you, but we are running behind schedule, so you can connect offline. Thank you very much. That was a stimulating discussion we had. We thank all our esteemed speakers. I request Mr. Anil Rajput sir to please join us on stage for the presentation of mementos. Ma'am, please give us this opportunity to thank you. Requesting Mr. Rajput to kindly join us on stage. And ladies and gentlemen, we would request you to kindly ask your questions and comments post the conference as we are running behind time. We'll first present it to the session moderator, Dr. Rajesh Kesri, sir, to please step forward. Please put your hands together for Dr. Kesri. Padma Shri Dr. Malvika Sabharwal, ma'am, to please step forward. Kindly keep the applause going. Dr. Manu Madan. Dr. Amitabh Yaduvanshi. Kindly keep the applause going. Dr. Manju Kesri. I now request the esteemed panelists to please come together for a group photograph, and with this we'll conclude the session. Kindly come together. Thank you very much. Ladies and gentlemen, with this we conclude this session, and we'll quickly begin our next session titled Polluted Air, Troubled Mind, Mental Wellness Challenges and Neuro Risk. We'll quickly prepare our stage for this time, and we aim to begin in next 20 seconds. We request you all to kindly remain seated. Post this, we have one more session to go, and then we'll conclude with lunch. Polluted air contributes to anxiety, depression, and cognitive impairment, developmental delays in children, and increased risk of degenerative disorders, along with mechanisms, socio-environmental factors, and preventive strategies. It is all set. Ladies and gentlemen, please join me in welcoming the esteemed session moderator, Dr. Karan Thakur, Group Vice President, Corporate Affairs and Sustainability, Apollo Hospitals Enterprise Limited. Can we please put our hands together and welcome Dr. Thakur on stage? A very warm welcome to you, sir. Now it is my pleasure to invite our distinguished panelists for session 2. We have with us Dr. Akash Srivastav, Additional Director and Head, Center for Climate Change and Health, National Center for Disease Control, Ministry of Health and Family Welfare, Government of India. Please put your hands together and welcome Dr. Srivastav. Can we give them a more energetic round of applause? We also have with us Dr. Shamsher Dwivedi, Director, Department of Neurosciences, Max, Dehradun, Dr. Rahul Gupta, Senior Director and HOD, Neurosurgery, Fortis Hospital, Noida. Kindly keep the applause going. Dr. Sumit Singh, Chief Neurology, Artemis Hospital, Gurugram. Dr. Atmanpreet Singh, Senior Director and HOD, Neuroscience, Sharda Health City. Once again, a very warm welcome to all our distinguished dignitaries. Dr. Singh will join us shortly, and for now, I hand over the proceedings to esteemed moderator for further.
Thank you so much, and thank you to the organizers, the Illness to Wellness Foundation and FICCI for this very important and timely discussion. I think the previous two panels have really set the tone for what is ahead of us and what we are witnessing in terms of air pollution and its impact on health. This session will be no different. I have a very eminent panel here with us to discuss two primary aspects of air pollution which we've not touched so far. One is to look at neurological disorders and how air pollution and climate as a whole is really impacting them. We've seen a range of organ systems being impacted, but focus with the specialists here on neurological conditions. But also to see how this impacts the age spectrum from the very young to the very old. We know that developmental anomalies because of air pollution in children is an issue. We'll also touch upon some aspects of school closure and what that does for mental health and well-being for children. But also at the other end of the spectrum, as India lives longer, we will also have the scourge of Alzheimer's, Parkinson's and other degenerative disorders. And how does air pollution really play into that? And we're very privileged also to have Dr. Srivastav here with us to talk about what the government's response has been. I think we've dwelt a lot on the impact of air pollution and how it's impacting human health, but also to know a systemic response on how the government and public policy is really shaping and responding to this. So thank you once again and welcome to my esteemed panel members here. I'd like to start with Dr. Dwivedi. Sir, if you could just lay out for us, what are the current and emerging risks as you see, in your practice over the years, if you could just sketch for us in terms of air pollution, its impact on neurological conditions very specifically.
Thanks, the organizers, Anil Rajput ji, for inviting me for this lecture. Yesterday I was coming from Dehradun. I shifted to Dehradun from Delhi, primarily because of air pollution. So when this topic was broached up and I was driving down, when I reached Delhi, suddenly there were tears in my eyes. मुझे लगा कि ये नॉस्टैल्जिया है. थोड़ी देर में पता चला नहीं, ये नॉस्टैल्जिया नहीं है, ये दिल्ली की हवा है जो मेरे आँखों से आंसू निकाल रही है. और फिर निदा फाजली जी का वो याद आ गया शेर, सीने में जलन आँखों में तूफान सा क्यों है, इस शहर में हर शख्स परेशान सा क्यों है. एंड देन आई मेट अ फैमिली, दे आर वेल टू डू फैमिली. और मैंने कहा पोल्यूशन का क्या हाल है. बोले आज तो पोल्यूशन कम है. एंड आई सॉ द मोबाइल, इट शोज द AQI वाज 338. बोला कम है मतलब. बोला कल तो चांद दिख नहीं रहा था, आज चांद दिख रहा है. कल रात को चांद दिख रहा था. बोले कि आज तो चांद भी दिख रहा है. तो अब लेस पोल्यूशन और मोर पोल्यूशन वाला हाल हो गया इस शहर में. नाउ व्हाई आई शिफ्टेड वाज बिकॉज माय मदर, हु इज नाउ 80, when I got her X-ray done, it shows pulmonary fibrosis, and that was the reason why I shifted to Dehradun. Now, what happens with pollution is that most of the pollutants, we have been listening about PM 2.5, PM 10, nitrous oxide, aromatic hydrocarbons, they are all generated because of human activity in bigger cities. And when they enter the lungs, they all cause inflammation in different organs of the body. The same inflammation which we have heard in the previous talks also enters the brain. Brain के पास प्रकृति ने एक blood brain barrier बनाया है जिससे कि toxins अंदर ना जा सकें. But these toxins, they even enter the brain, and once they enter the brain, they play havoc. वही smoldering, वो सुलगी हुई आग जो है वो नुकसान करती है और हर एज ब्रैकेट को करती है. बच्चों में कॉग्निशन इफेक्ट होता है और
जो ऑटिज्म का इंक्रीज हो रहा है, ऑटिज्म और मेंटल डिसऑर्डर, जो कंजेनिटल मेंटल रिटार्डेशन जो बच्चों को होता है, एंड there is now hard evidence that exposure of pregnant ladies to these toxins has increased the number of autistic children in the society. Then in the working group, the people who are in the age bracket of say 25 to 60, those who are going to offices and they are more exposed to pollutants. The problem which is this fidgetiness, the irritability, the anger, somewhere the brain inflammation changes your behavior and also affects your productivity, your interpersonal relationship and productivity. अब शाम को लौट के आए पूरा pollution गुस्सा family पे निकल रहा है. Third is the elderly. What happens in elderly, all organs including brain, the reserve is less. Because of aging, the brain reserve is less. Already brain में काफ़ी neurons खत्म हो चुके हैं. And there this inflammation and exposure to toxin tips the balance and the person goes towards Alzheimer's, Parkinson's and all these disorders. Then there is a hard evidence of association between exposure to pollutants in air to these neurodegenerative disorder, and that is primarily because normal aging is happening, the brain reserve is less, and this exposure to pollutant just tilts the balance and early onset of neurodegenerative disorder.
Right, so it's quite wide ranging and it is high impact and has impact not just on physical, mental health, but also well-being and longevity. So thank you for laying out the various risks involved with that. Dr. Gupta, I'd just like to bring you into the conversation. You heard Dr. Dwivedi speak about the wide-ranging impacts. And we know that cardiovascular disease, stroke, etc. Are now constituting the majority of mortality, morbidity in our country. How much of air pollution is attributable to things like strokes and other conditions?
So when we talk about pollution, so basically we are breathing in an air which has a lot of pollutants. And what are these pollutants doing in our body? They are leading to inflammation. In last two sessions we have discussed a lot about this word inflammation. What is this inflammation? Inflammation is a mechanism of the body to fight against the enemy. And that is inflammation, but that doesn't come for free. That comes with some damage to the body itself. So the inflammation which is happening to fight against the enemy harms our body itself. It increases some water inside the cells. It increases in some amount of cytokines and various other products inside the body which are harmful for the body. So similarly, when they are damaging the blood vessels, leading to inflammation of the blood vessels because of the oxidative stress, because of the endothelium, which is the inner wall of the blood vessels, damage to the endothelium, there is an increased chance of blockage of the small vessels. And sometimes the large vessels also may get involved, and these lead to strokes. So what is stroke? Stroke is basically blockage of blood vessel in any part of the brain. So if there is an inflammatory process, blood vessels are getting damaged because of the inflammatory process, the vessels are getting blocked, and there is an increased chance of stroke, and then stroke will lead to deficits. So this is the pollution, how it increases the chance of stroke.
And beyond stroke, do you see in other conditions also for neurological conditions?
So since inflammation is a generalized phenomenon which is occurring in every part of our body, it is including the microvascular structure, the neurovascular structure of the brain, as well as it is disturbing all the chemicals in the brain, especially glutathione, fatty acids. So all the cytokines released in disappropriate amount in the brain injures the cells, injures the cell covering, and this enhances and it promotes the degenerative diseases. A person who is prone to have a certain degenerative disease at the age of 70 or 80, he will start having those symptoms or those phenomena at the age of 50s, just because the pollutants are adding on to those damages.
Right. So, so we see that again, thank you for pointing out about inflammation again, how that is playing a role, and I think that's a common thread that's running across on the impact. Dr. Singh, I'll just like to bring you in. You've just heard, even in the previous sessions, about the impact that air pollution is having. To your mind and in your practice, how are you seeing toxins, neurotoxins, and also this inflammation playing out? And also, is there a difference in sort of socio-economic demographics between the urban rich, the urban poor, between rural and urban. Do you see that stark divide, or is it now that, air pollution is so widespread that, it's becoming common across the length and breadth of India?
Let me come to the first point. Considering the neurotoxin thing. Now, all of us know that there are some specific neurotoxins which are well described in literature, like lead, aluminium, botulism. So, we know this causes a specific disease. So, we have a treatment specifically for that. Now, pollutants per se, there is no one pollutant, there are multiple. It's a gambit of pollutants which are affecting our brain. And the effect, as Dr. Gupta already told, it causes stroke. Vis-a-vis, it can also cause cardiac arrhythmias. It can also cause hypertension because the vessels are thick. So, described in literature, purely neurotoxins, we have only one or two specific diseases or entities, but this is actually affect multiple organs. So, you can have multiple diseases at the same time going on in a person. Coming to the urban versus urban rich, urban poor and rural. Now, if you see the AQI, today it's 500. So, it will not make a difference whether you are at 450 or at 500 or you are at 350 or 500. Urban poor, I should say, the stay or the place of residence will be more congested, it will be more dense. So, the pollution effect will be more, definitely. If you see this area, which is NDMC area, it's more greener, less of pollution, probably. But on daily basis, this will not affect your disease process. Whatever we are inhaling on daily basis, on long term it will cause diseases, and short term and long term both. So as such, I think, and in rural, the main issue comes with pollution in the house as such, wood fire or pesticides what we are using for the farmers. So that's a different group overall, but this area which is urban rich, urban poor, per se we are hovering on 400, 500. Disease processes are also same. It will not affect the long term outcome as such.
So we need to see this as a public health issue,
Yes,
which is
yes.
widespread, and it is like
It's almost same.
Yeah, like earlier we used to call various diseases lifestyle diseases, but it is, we know there's not so much lifestyle, but a public health issue because of these various.
Yeah, it's more of a city disease, I think.
Right. Right. So thank you for that, and I think that's a good segue to bring in Dr. Srivastav into the conversation. Many of you may or may not know that India is one of the few countries which has a national program on climate change and human health, which is housed under the NCDC, under the Ministry of Health and Family Welfare, Government of India, and Dr. Srivastav has been helping that since it was put together in 2019. So thank you for being here, sir, and also want to understand. You're hearing the issues around air pollution and impact on human health. What has been the public policy response and from institutions like NCDC?
Okay, thank you. And at the outset, I would like to first of all thank Illness to Wellness Foundation for organizing along with Vicky this event, because it's the need of the day that the clinicians get together and talk about this important public health problem. It was as highlighted by the former Secretary Health and Family Welfare today morning. One side is talking about the air itself, but the more important part now is to talk about its public health impact. And one thing that came out in the last line of your conversation with the speaker is that yes, it is not something that affects one group or the other, it affects everyone, and this is how air is different from any other public health challenge. It does not discriminate between groups, it's everyone's problem, and so people need to know that air doesn't know boundaries. What is the government doing about it? It's been now a long time that we have been at the national level, state level and the district level been working towards this problem. When this program was put in place, we tried to put the state level officers and the district level officers identified under the program from their respective health departments to also look into the matters of air pollution and health. To begin with, the foremost requirement that we have is to create an awareness about the problem among the people. And to begin with that, the first thing that we do is that every time when the winter is about to be there, an onset of winter, there is an advisory which is released by the Secretary of Health from the Government of India to all Chief Secretaries of the states, highlighting the major issues relating to health of the problem, and also providing the do's and don'ts that the health people need to know, and also for the public also. And these advisories are then in a cascade manner run down up to the district level and sub-district level. In context of creating awareness, we generally have a lot of IEC material that is being developed. It is targeted at both the urban population. We try to reach out through social media for people who are frequent to social media, and right up to the rural area, right? You will have wall paintings and other measures down in the villages where social media and other are not the measures of reach out to them. It could be miking, it could be gathering and road plays, etc. But one thing that is very important is for those who use social media, and I think I need to highlight it at this point, people when they try to understand what is the air quality, they usually reach to the measures that are being posted on Google by various international agencies. You have to understand that many of these agencies, they rely on satellite data to understand air quality data. There are two apps, one by the Central Pollution Control Board by the name of Shamir, that is available to download on your phone, and another is Suffer by the Ministry of Environment Sciences. Both of them provide you the grounded information based on ground monitors, so which is more reliable in context of understanding the air quality data to make your decisions of the day. It also provides, along with the air quality information, it gives you the information about what is the likely health impact of that given air quality day. And through our IEC, we try to talk about it, not only in general IEC, we hold intensive campaigns, mostly around September, when the winters are about to onset. That is also on the 7th of September, there is a UN International Day for Clean Air, for Blue Skies. That's the day when we have around week-long to 10 days intensive campaigns across all rural villages of the country. The another one is the National Pollution Day that we have on 2nd of December. There's another time when we have a long intensive campaign being run out. We have specific sensitization workshop held for specific targeted groups. There's some people like traffic policemen, municipality sweepers, women, children, elderly, those who work in construction site, laborers. Therefore, we have targeted sensitization workshop for such people who are exposed and need to understand how air impacts them. Then the next area on which the government works is capacity building of its health workforce. That's been developing training material, running out training workshop for all its cadres, right, from doctors to the health workers. And we have now something known as IGOT, which is a platform in the government structure which provides opportunity for all government doctors to have an electronic reach to the teaching materials. So we should post it out there. We also participate in workshops and conferences and organize them at our end also for our own professionals. And we are happy that other people also, such as today, we have this workshop out here. Another thing that we are working on in terms of awareness is working on medical curriculum. Most of the doctors who are present here during the time when they were doing MBBS, air pollution was not being taught very actively. So we are working out with all the 6 councils, whether it is the National Medical Council or the Directorate of Board Examinations, or with the nursing, or with the homeopathy, or with the Indian Council, or allied practitioners, trying to tell them that they need to change their curriculum, and working intensively on this now for a couple of years, and the changes have been happening into a curriculum. There is an induction training that happens for the doctors who are inducted into central health services. They undergo an induction training, and we try to, during that induction training, sensitize them, because they may not have during their curriculum been aware about it. The next is the work that we do in health sector to make changes. There is a national action plan in place since 2019, released by the Union Minister of Health and Welfare. And then we also have now state level action. Last year, the Honorable Prime Minister released state level action plans for all the states. We're working with now with the district government, put in place air pollution and health related action plan for them to work on. We put in place a surveillance system which works on sentinel sites across cities which are so so-called the non-attainment cities. There are 131 cities identified in the National Clean Air Program, and we are trying to expand even beyond to other cities. The big-scale hospitals in these cities are identified as sentinel hospitals. From emergency data, both pediatric and adult patients, the data on respiratory illnesses is collected, identified for the interventions that have been taken, and then matched against the air quality to understand the trends over the time. Then alerts. We also get information from the Indian Meteorological Department on the AQI forecast, and then we spread this information through alerts through our closed WhatsApp group right up to the district level, asking so that their hospitals be on alert during those such days. We are putting in a new initiative in place. We are asking the hospitals in the government sector, which are large-scale hospitals, to put in what is called a chest clinics. We are calling it chest clinic because to begin with the pulmonary cases at least, we fully understand how much cardiovascular and stroke and other illnesses are relevant. But to begin with, we are asking at least to hold it for children and adults who are affected by pulmonary cases. Maybe this hospital will over the time also increase to move on to the other. Important work that we have to work on is household air pollution, and I would like to re-emphasize for the clinicians, it is at least one place where the clinicians can play an important role during consultation. Ambient air pollution, you may not be able to make much difference to the people, but women and children who are still exposed to smoke in their own houses, we heard in the previous session how it affects the child health from 0 to 5 years, which are developmental critical years for the child. That's the area we need to work on. We're also working towards 3 main programs, the mental health program, the national program on NCDs, and also the reproductive child health program, to see that these programs also make necessary changes related to this important area. So overall, I would say these are the major areas that I can quickly list you of what we are doing. But to come to an end, one of the most things that I would like to say is about the role of clinicians and the role of private sector for this particular audience. The role of clinicians is that you are, as I can understand, a quite learned. The talks that I heard today seems like the clinical workforce in this country is smart enough to understand the impact. Reach this information out to patients in your daily consultation. Understand what is their risk. Even though in NCDs they have listed risk factors, air pollution as one of the 5 risk factors. But during conversations, I always see it's more a talk about their diet and physical activity instead of risk factor of air pollution. I know it is not so much that you can do about it, but at least for household air pollution, there is a lot that the family can do. So that's where you need to change their mindset and try to protect themselves. And the private sector, of course, participate in our surveillance, try to put in important clinics related to air pollution during these seasons, even 1-hour clinic, so that people not only understand but get special attention to air pollution diseases. Thank you.
Thank you for that. I think you've laid it out in terms of what the government's response has been, and it's been fairly robust. You see health system strengthening, there is IEC, there is also capacity building, and also these tools being made available for better access to information. And thank you for that call also to work collaboratively across the sector, so that we break away these silos. Just like air pollution has no limits and does not see boundaries in the health system, we should also be responding to it accordingly. In this round, I'd just like to also now touch upon, we've spoken about neurological health and impact of air pollution on stroke, and we've heard the public health response and how it is a public health issue. Dr. Dwivedi, I'd like to bring you in on the issue of what air pollution is doing for the elderly in terms of dementia, Alzheimer's, sleep disturbances. Are we seeing a change in that, and how do you foresee this planning out?
So, as I mentioned in my opening statement that in elderly, since the brain reserve is also already less because of aging, any inflammation, any injury just tilts the balance. So, what I saw in my practice in Delhi was there could be various factors, but definitely those who are living in Delhi, elderly patients, their OPD attendance used to increase during winters. It is understandable if it was just chest, but even the neurological OPD footfall increases in elderly group in Delhi during winters. So that can indirect evidence, I can't give a hard data, but it is an indirect evidence that this increase in neurodegenerative OPD attendance could be because of two reasons. One is incarceration at home, and the second is the air pollutants affecting the brain function, so that there is a dip in their memory functioning, cognitive functioning, mobility, etc. So I feel that there is a definite impact in our city when it comes to neurodegenerative disorders, which you mentioned in the OPD footfall.
Right, thank you. Dr. Singh, Sumit Singh, I'll just like to bring you in. Thank you for joining us. We've discussed, the impacts of air pollution on various neurological conditions, but also more widely. How do you see this in your practice, especially when you look at the spectrum of the elderly and the young? What has your practice guided you towards in terms of the impacts that is being felt?
So pollution has a lot of impact on the inner lining of the blood vessels. So these smaller particles, they tend to cross directly and they can damage the blood-brain barrier. And it also increases the damage to the endothelium, which is the blood vessel's inner lining. So stroke increases because of this. The patients who already have stroke, their chances of repeated stroke increases. And patients' brain becomes more reactive in terms of headaches. Like young people have lots of migraines, and when the pollution increases, the migraine intensity increases several folds. Physical activity is very important for prevention of these problems. And during the pollution, when the patients or the people cannot walk out because of the pollution being so rampant, so their blood pressure shoots up, and therefore their risks of headaches, their risks of other neurological problems also increases. So like today we had a patient who was routine hypertensive. He forgot to check his blood pressure, and during the morning walk he had a brain hemorrhage. So these things will definitely crop up.
Right. So unfortunately it's a lived reality happening day in, day out in your practice. Like as you said this morning, Dr. Gupta, I'd like to bring you in for younger patients, for children and adolescents. We know that climate anxiety and general well-being because of the climate crisis is becoming an issue. What are some of the health issues that one is seeing in children in mental health because of air pollution or related issues?
Yeah. So since everybody is breathing the same air, and elderly children or middle-aged people, everybody is breathing the same air. In children, the chances of having sinusitis, aerorespiratory infections, they increase tremendously, especially in the young children, where sometimes the immunity is low and they are not wearing properly, they are not taking all precautions. So there is a brain fogging as well. On one hand, they have sinusitis, they have blocked nose, they are coughing. Secondly, they are breathing in the air which has a lot of pollutants, which is again injuring the brain through inflammatory methods. And they are not allowed to go out. They are constantly in their homes. Schools are being shut because of the pollution. So constantly remaining inside the home adds on to the misery. So one is the pathological part, which is the sinusitis and the inflammatory in the brain. And second is the psychological aspect, that they are not able to go outside. Constantly they're in the same environment. They are being pushed to study, read books. Some are sorting to just television or their mobile phones. So it is impacting their overall health, especially the mental development and brain health, and this has a serious impact on them. Apart from them, if you talk about very younger population, even the infants, then there are various other diseases which, because of these pollutants, the chemical changes in the brain, they lead to these problems.
Right, thank you. Dr. Atampreet, I'll just like to bring you in on this question as well on the impact we're seeing, schools being closed, children not being able to play outside, not being able to meet socially. At least I don't consider online meetings as socializing, unlike the younger people today do. But how does that really impact developmentally and socially children?
See, for the child to develop, you have to have interactions. So the child need to go to school. That actually helps in overall development, cognition as well as physical both. So with this stage of pollution, when the schools are shut, the child is forced to sit at home. He is on screen for next 6 hours. He is not able to go out. That can create some anxiety issues. He is not able to go out. He is not able to play. Emotional stresses might also increase. Attention spans also may come down because of increased screen time. So whatever studies are there, as the prenatal, postnatal, preschool, school. So the more the number of pollution percentage wise in terms of AQI, more is the risk for all behavior issues in the children like autism, ADHD or other substance abuse also can increase along with these. So it's a whole gamut of things which is happening in child's mind and child physical life also.
So before we move to the last round, which is really talking about what are some of the preventive measures that I'll ask my esteemed panelists here, I'd just like to bring in Dr. Srivastava again. So what are we doing for you spoke about it briefly about focus groups. So for children and the elderly as part of your program, how are they being reached out to, or how is IEC material being made available to them?
So yes, that's very true. Some of the groups, especially demographic groups like small children and elderly, are very vulnerable to the scenario of air pollution's impact. And as I said, there are two major programs now. We have one program for the children, that is a reproductive child health program, which covers from the pregnant mothers right up to the early child age of the mothers, and also adolescents as well. We were trying to work with that program. Recently, they had a SARS campaign, which was related to pneumonia in children. And we, in the campaign, we put in the word of air pollution very effectively, so that whenever the awareness is being created or the data is being collected from the families about child illnesses, they will also collect information about their exposure to fossil fuel and the likelihood of the child's pneumonia and illnesses being related to that, and ensure that during the messaging, it was clearly been mentioned to the mothers and the parents of the given children. So similarly, other matters of awareness and capacity buildings are addressed in this program, and also in the another program that we have for elderly, the word is there. The areas that I have important to say about is that specifically in terms of children is, we all know that this is age when the child gets programmed for all the other diseases that he may develop later in the age in the child. A lot of evidences have come up in the understanding of how life course epidemiology of these diseases are. Therefore, it's very important that we understand that the mothers are protected from the time that they are ready to become mothers until the child is born, and also the early 5 years of the child.
Right, thank you for that. We just have a couple of minutes left, so I'll just start from Dr. Gupta and move leftwards. What are some of the preventive strategies that you would like to recommend to the audience and to the general public?
So when you talk about pollution, the air pollution which we are facing presently in Delhi NCR, so we have to remain indoors, we have to have air purifiers. When going out, we have to wear masks. As in the previous panel discussion, they discussed about the N95 mask with a filter, which we can be worn throughout to prevent at least the bigger particles from entering our system. And secondly, we have to have some contribution. First is to save ourselves. That is what we do by having air purifiers and the masks. And secondly, for the environment, we have to do our little bit, like segregation of waste, like reducing the vehicular pollution. That is the most important thing which we can do. Apart from that, we can refrain from our staff or maybe from the rural people from in our cities from burning these coal and the plants and all these things just for heat. And we can provide them with some warm kumbals and all, so that they don't need that. So these are the small bits which we can do for ourselves as well as for the environment.
Thank you. Dr. Dwivedi, would like to add on?
Unfortunately, we would like to have a prevention against air pollution, but unlike water and food pollution, you can't avoid it completely. It is not possible. We can talk about air purifier, we can talk about mask, the only way to prevent air pollution is to clean the air, because the experience with COVID is that no matter how careful one was, COVID was something which hit everyone. 90% positivity in the population in those countries where there was no vaccination. So finally, PM 2.5 will enter your body, no matter what you do, in a lesser or a greater quantity. Yeah, greater quantity can be avoided by the measures Dr. Gupta just now said, but पहले जो जो कचरा जलता रहता है उधर इंदिरापुरम के आगे, उसको बंद करें। अगर वही नहीं बंद करेंगे, कचरा जलता हुआ छोड़ रहे हैं वहाँ पे, माउंट ऑफ वेस्ट इज गेटिंग बर्न्ड. That has to be stopped first. Talking about mask and talking about air purifier is foolishness. Absolute absurd. Prevention पहले करना होगा. वो जो कचरा जल रहा है वहाँ से उसको बेटर वेस्ट मैनेजमेंट करना होगा. कचरा जलता छोड़ रहे हैं, हवा गंदी हो रही है, बोल रहे हैं कि वो जो गार्ड है वो क्यों चूल्हा जला रहा है कोयले की. अरे वो तो कचरा तो वहाँ पे एजेंसीज जला रही हैं, पूरा का पूरा शहर का कचरा, वो बंद कर नहीं पा रहे, उसको बोल रहे हैं कि तुम कुछ वो रात को आग क्यों ताप रहे हो.
Thank you for that, Dr. Singh.
I think we have to follow these guidelines, so-called GRAP guidelines, both in letter and spirit. Why did I get late today? I got late because so-called trucks are not supposed to enter the premises of the center of the city. So what have people done? They have made smaller trucks which are allowed. Now these larger trucks were initially allowed only in the night. These smaller trucks are allowed 24/7. So there was a crowd of at least 500 these small carry away vans which were there on the way, which led to this traffic jam. So to counter the measures, we have found ways to follow these GRAPs in words, but not in spirit. So I think the implementation part is the most important. Talking about the policies, talking about what is available in paper and not implementing it, and we all are part to it. I mean, if I have a business, I would also want to have some opportunity of making my stuff reach the place where I want to be. So I'll find for alternatives, but there has to be some strictness in spirit rather than the letter alone.
Letter and spirit, very important. Dr. Atampreet?
Yeah, I think most of us agree on this, on these issues and points. I think as Dr. Anil Rajput, we had just had a word with sir. We should have more frequent meetings to sensitize and awareness creation among the public. That should be the forefront actually. All of us are aware, but we are on paper writing, but it has to be made aware to the common man also. Common man means it can be urban rich, urban poor, rural, everyone. So if all of us are on the same page, then only we can clean the air.
Right.
Otherwise, we cannot.
Thank you. Dr. Srivastav, last word as a public health specialist,
So,
what is your advice?
To end with, I have one suggestion for all the clinicians. Unlike other illnesses like diabetes or hypertension, you have a measure that you write down on your case sheet to say that Mr. A has hypertension or Mr. B has got diabetes. You cannot individually pinpoint using any parameter that Mr. A or B is affected by air pollution. The only thing that works is taking the history of the patient. You are trying to understand how much was the exposure to Mr. A or B to air pollution, and that needs to come down on your case records. Now in ICD-10, there are ICD codes for air pollution exposure. So you not only write the diagnosis in ICD code 10, you can also write down air pollution exposure available on ICD-10 codes. And also now in ICD-11, we don't use them much in India, but at least ICD-10, that's a part of documentation process. Unless until doctors who see patient do not document that the patient that they saw today was heavily affected by air pollution, it will never come onto the records of any sort of data analysis. So that's a major challenge that the doctors have to understand to make a difference. Population level databases are not individual level databases. That is why you see that diabetes and hypertension get more track, more effort towards them, because you understand individual level patients, while you don't understand the environment related problems because you do not have individual level data. But doctors can make that change by putting that on records. Thank you.
Thank you. That's
I think one point, I think as I think sir has already pointed out, I think we can formalize the study here itself with sir, everybody sitting here. So we can have two groups of patients with stroke and heart disease, one having all the risk factors, or you can divide into two groups, stroke, hypertension, diabetes, cholesterol, or any other disease. And someone with stroke with no cause, maybe we can add pollution to that. So we can have two groups and see what is the effect of pollution. Someone, there is no history of any disease, has a stroke or a MI, and see, is there any effect of pollution on that or not?
In a city like Delhi, all patients are exposed to pollution. So that will be added as one of the factors.
So I think it's a productive session where we have a research methodology and outline already placed. So I think thank you for that. Thank you to my esteemed panelists for this wonderful discussion. In the past 40 minutes, we've been able to cover a lot of ground in terms of neurological conditions, neurodegenerative conditions, mental health and well-being, what the public health response has been like, how we can strengthen the health system, but individuals also, the need for collection and collaborative action, and what are some of the preventive measures that we all can take, both systemically, and as individuals. So thank you very much, and I'll hand it back to the organizers. Thank you very much.
Thank you very much for an insightful and thought-provoking session. I request Mr. Rajput to please join us for the memento presentation ceremony. We'll begin with session moderator, Dr. Karun Thakur, sir, to please step forward. Ladies and gentlemen, please put your hands together and let's thank them for sharing their expertise and valuable knowledge with us. Dr. Akash Srivastav, kindly keep the applause going. Dr. Shamsher Dwivedi, Dr. Rahul Gupta, Dr. Sumit Singh, Dr. Atmanpreet Singh, thank you very much. Kindly come together for a group photograph, and with this we'll conclude the session. Please step forward and come together. Thank you very much. Ladies and gentlemen, with this we conclude this session and we'll begin the final session for the day. In next 20 seconds, we'll quickly prepare our stage. Meanwhile, we'll encourage and request you to kindly follow our social media handles of Illness to Wellness Foundation and stay updated on all the relevant, important information and preventive measures related to such important topics as air pollution, which we are discussing today. We'll also, it's time to begin the final session for the day on air pollution's impact on child health and education. And we are all ready to begin. To moderate this extremely important and sensitive session, may I invite on stage Dr. Sudhir Kumar Kalhan, Member Advisory Council, Illness to Wellness Foundation and Chairperson, Minimal Access and Bariatric Surgery Center, Sir Gangaram Hospital. Can we please extend a very warm welcome to Dr. Kalhan. A very warm welcome to you, sir. And now it is my pleasure to invite our esteemed panelists for the final session. We have with us Mrs. Alka Singh, Principal Air Force Golden Jubilee Institute, Subruto Park, New Delhi. Kindly keep the applause going. A very warm welcome to you, ma'am. Dr. Sai Kiran Chaudhary, Senior Consultant and former HOD, Pulmonology, Critical Care and Sleep Medicine, Delhi Heart and Lung Institute, New Delhi. So will be joining us shortly. Dr. D.K. Gupta, Chairman and Managing Director, Felix Hospital, Noida. Kindly keep the applause going. Mr. Sanjeev Yadav, Principal, Alcon International School. Once again, a very warm and hearty welcome to all our distinguished dignitaries and speakers for the session. And I now hand over to esteemed moderator for further proceedings.
Thank you so much. I think, although it's the last session, but I think it is the most relevant session because we are going to shift from environmental pollution only to a cause which is, I think, is a fundamental right and developmental issue. Children of any society, of any country, are the future of that country. India is a young nation. More than 60% of the population is less than 30 years of age. Very young, large population is a young population. And these are the children who are growing, organogenesis is happening. And when they face air pollution, I think the ramifications and the effects are much more devastating than what will happen to an adult who's facing. A small, a sapling will have more side effects of air pollution than a properly grown up tree. So with this thing, I start my panel discussion, fortunately to have two educationists with us, two clinicians, and we are going to talk about preventive measures more than, we all know what air pollution is doing. So, and what are we doing to prevent that air pollution? I think I'll start off my panel discussion with Ms. Alka, who's a principal at Air Force Golden Jubilee Institute. And ma'am, right away, is air pollution just only an environmental issue? Is it not a fundamental right issue because it concerns the growth and development and the education of a child, ma'am?
Right, thank you so much for the question. Immense gratitude to Illness and Wellness Foundation, Mr. Rajput, for inviting all of us. And of course, this topic is close to all our hearts. I'll just share a small anecdote with you. In the 1980s, Anita was a young girl growing up in East India, one of the small towns. Very happy. She could open any tap and drink the water straight away from the tap. She went out for picnics and outings. The air was clean and pure. One could drink water from the rivers during picnics also. Something which is unimaginable now. Then, because of job opportunities and educational opportunities, she and her family migrated to Delhi. Initially, it was good. But now, she has to work from home, being an asthmatic patient, and she and her daughter both use nebulizers and inhalers. Scenario has changed completely. I think Anita's story rings today in almost every home, especially in the big cities. Things are much better in the villages and towns, but we know that because of lack of opportunities, most of us have migrated to big cities. As far as air pollution is concerned, what are we offering to our children? Two of us represent schools. Today we are having hybrid classes and online classes. But is actual learning going on? A big question mark. The children are hooked on the screens. Are they really learning? Learning cannot be complete if there are no sports, if there are no co-curriculars, and of course academics is happening, but in a very limited way. I'm speaking to you all very, very honestly today. We have a set of 10 fundamental rights for children. Out of that, 3 of them are right to survive, right to good health and well-being, and right to a safe environment. All of us are so educated, all of us sitting here under this roof. Are we giving them to our children today? Food for thought. I can see so many young people sitting at the back. What kind of a planet are we going to hand over to them? We elders are to be blamed. There are a lot of things being done, but on ground, the reality is something different today. We need to have concrete steps implemented at every level. Then only we'll be able to hand over a healthy planet Earth to our next generation.
I think, ma'am, our children are not going to pardon us for giving them such a back a city which I was born in. I am not able to give even 10% of that to my children.
They will never be able to forget
Absolutely.
or forgive us.
There is a deterioration and rapid deterioration in the environment.
Someone rightly said, we have not borrowed this earth from our ancestors. You know, we have to preserve it for the next generation also.
So, ma'am, I think I'll move on to the next educationist. Mr. Sanjay Yadav is here. Sir, how does, have you seen that air pollution is deteriorating the education in a way that is the attendance getting affected? Is the growth of children getting affected? I mean, as a doctor, we encourage children to go and play out. We keep on saying obesity is increasing. We keep on saying it's very important for the child to run around. But where is the environment for the child to run around, sir? So what is your observation? How do you see the deterioration of the system over the years as an educationist who has been involved in teaching for a long time?
Greetings, everyone. I'm sure very thought-provoking discussions which have been happening, but at the same time, when I'm representing a school ecosystem, so everybody can look back into their own experiences with school life and try to understand what contribution have school systems had in us so that we are here today and we are in a position to discuss or deliberate whatever capacities have been developed in this. So are we able to really develop those capacities? And when it comes to a very simple learning or development of a child, there are three components I'll mention here. People might consider schools as a cognitive center of learning, but trust me, the learning through cognitive means is contributing only to 10% in reality. It's rather 20% of learning which happens socially. So schools, can they actually impact social emotional learning of the children? And the role is 20%. The other 70% happens from the experiential learning. Now what our children are experiencing in their day-to-day life, how are they experiencing in terms of or from the ecosystem they are living in, I'm sure the answers are evident to everyone. Having heard stories from people and families coming and sharing with us that we have been medically advised to relocate from a city. Now imagine, a child who has been in a certain zone, developed certain things, and then the entire family has to take the stress of preventive health care. The child facing an elderly at home, having health issues, and because of that the family has to take a decision. What is the experience which the child is gaining from there? And this has somehow become a harsh reality in the life of these children. So it's not just looking at their physical presence in school or their virtual presence in an online class or hybrid. We may say that, okay, to some extent, whatever system has given us, we are trying to cater to their needs, but are we really able to cater? Can you imagine that over past few years, I have seen the schools which in this month of November or December, majority of you might have seen schools used to have annual days, they used to have sports days, and those are the activities. Looking at school calendar, the whole thing has drastically changed. And then when these things are changing, just to accommodate, on one side we are stepping back, trying to create alternative. At the same time, there is no sight for relief. This is every year, everybody is prepared. I asked a child in grade 5. He was walking and he said, I said, what did you study today? He said, we were taught about seasons. I said, okay, so how many seasons do we experience? And imagine a grade 5 child giving me an answer saying that we have summers, we have winters, we have rains, and we have pollution season. And we get holidays for pollution also. Now this is the impression of a grade 5 child. This is what he or she is inheriting from our system. So this is a sad and harsh reality. And in spite of having all wills, eventually I would only believe in what changes really happen in the lives of these children. Then only we'll be able to say that yes, they are developing and growing and we are able to contribute and play our role.
So how are these schools now? Air pollution is here to stay for at least 3 to 4 months in Delhi. I don't see anything happening. So how are the schools, both of you ma'am and sir, that how are these schools gearing themselves to face this war-like situation, I would say? Have you made some changes in your school environment or the way you look after children so that the impact of air pollution can be minimized? Of course, prevention is the best way and the government should be working on that. But how, as a school, are you gearing up to keep the impact of air pollution to the minimum? Because these are vulnerable children. Children, they cannot be wearing N95 masks. They don't understand what is N95, they want to go out, run out. So as compared to the adult population, they are much more vulnerable. Organogenesis is happening, the lungs are growing up, everything is changing. So the impact is much more. So how are the schools? Are we doing some specific steps to take care of the children? Because a significant portion of the time the children is at that school.
Right. In my school, there are about 2,300 students on rolls. Primary wing is totally online. Some special wing children are coming, and of course we are having some exams also. So some classes are in hybrid mode. There is very little we can do in schools. At the most, advisories have been issued to wear masks, no outdoor activities, even sports is being played, whatever little space we have for badminton and all, indoors. Whatever activities can be done inside the halls that we have. Otherwise, there is very little, as I spoke earlier also, of co-curricular or sports happening, which does not lead to a balanced development in children. So the situation is not so good, and like Sir said, that is going to continue for 2-3 months, then I do not know how are we going to conduct exams, and how will these children go to the next class. So online exams we have seen during COVID, there was so much of cheating happening, they were not really exams. Everybody had 2-3 devices, and they were giving papers online during COVID. Is that real education? We need to really think about it.
So I see one very helpless principal. Sir, do you think your school is doing anything different?
Right, so having looked at the situation, one, as I was mentioning, that the entire school ecosystem has looked into realignment of their calendar, so much so that even there was a court directive recently that sports activities should not happen somewhere in the month of November. So one, this is a preventive measure which you may say that a systematic reform which has been brought in place. The other thing which is happening now simultaneously at this point of time, I look at different age group of children. And grade 10 or 12 students who have to prepare for their pre-board or forthcoming board examination, which is deciding for their career, now that calendar cannot shift. There's no realignment of that calendar. And imagine children who are as it is under the stress of facing or preparing the examination, career deciding examination, have to face another adversary which has come in their way, and there is no prevention for that. So this is adding, and we see when it was being discussed about mental health of the children, it is impacting their performance, it is impacting their confidence, it is impacting their future planning, and unfortunately, within the same country when they are appearing in a national level examination, is it only the children in Delhi NCR who are facing this effect, who are facing it to the most? So the children who were considered to be more privileged, having more opportunities and access to information, are the ones who are suffering the most right now. That is also happening.
So another principal sending an SOS for help. That's what I can say.
It's an emergency.
I now would like to move to the clinicians, Dr. Sai Kiran, who is a pulmonologist and a sleep medicine expert at DHLI. Sir, why do you think the children are more vulnerable to the air pollution? And what are the short and long-term consequences that air pollution is going to have on the children?
Yeah, okay. So I'll come to it. I did a piece in the Times some few years ago, and we were on the same discussion about pollution. So if you look at the AQI, it is progressing every year. And every year this comes around, and it is actually, if ma'am said, the co-curricular, and I am seeing in the children, you can make out the difference in the psychological growth, social growth. You can feel the difference what is happening because of this, the pollution and the education, the lack of co-curricular activities. And unfortunately, I'm going to say this is going to be the scene next year also, and coming generation, until something drastic take place. So now coming to what happens in children. Most of the children would be born to parents who have been lived all their lives in Delhi. So we have already discussed the natal effects of pollution on the mother, the developing child, the first trimester. There is development organogenesis taking place, and then there are neurocognitive abnormalities can take place. Then coming into the Second trimester onwards, you have the lungs developing, the lungs maturity, and that same once the child comes. So the difference between child and adult is when in child, his minute ventilation or the volume of air that he takes is more than an adult per kg. So is inhaling more pollutant air as compared to adult. And when you look at an older adult and an adult and an older children, the same microgram per cubic meter of pollutant will have the same adverse effects in an older child compared to adult. So what we are talking about is, him having systemic inflammatory impact like cardiovascular problems, neurological problems, metabolic diseases, as pollution may trigger it. It may not be that all exposed to pollution are going to have that. So younger children, the short-term effects are, they are exposed because of the high work of, they have inhaled more air. There are more outdoor active, so they are again exposed to more outdoor pollutant air. Because the pollutants concentrate at a ground level, so they inhale more during outdoor activities. Then again, what we are looking at is, where are the schools located? How is the child commuting to school? Schools may have a good environmental, a buffer zone, green area where no traffic is allowed, only they can walk to the bus, but the commuting corridor is going to be high pollutant. So children are going to be exposed to the pollution every time, and geopolitically, Delhi is a dust bowl. We all know it. The impact of Himalayas, the Aravallis, the Arabian wind, the cold inversion effect. So it is going to remain a dust bowl throughout. And the urban heat, we know is how it is increasing with the urbanization. So a child, short-term effects would be like running nose, sore throat. Again, what happens once you're exposed to pollution? The immune system is developing. Sometimes the immune system signals very abnormally. It may create a very strong inflammatory response in the lungs, causing bronchiolitis, pneumonias. And once bronchiolitis, all these, the infections tend to exacerbate. Then you have the nutritional part also. The nutrition status, the same way pollution is affecting us, it is affecting the plants too. You are getting low yield, low nutritional quality from it. These days we see so many adults getting vitamin B12 deficiency, not heard of 5 years ago, not heard of. So children, again, as they grow older, the immune system tends, again the PM 2.5 particles, they absorb the allergens. They can make you sensitized, you get increased incident of asthma, allergic problems. And they then persist throughout adult life unless they are exposed to clean air, things change. And honestly, as Sir has said, yes, I've advised a lot of parents with young children having severe asthma, visiting doctors frequently and spending so much on diagnostic tests. I've told them it would be a better economic thing to go to a smaller town where the air is clean.
Dr. Sai, sorry for interfering in between, but I want to ask you, what are the warning signs? I mean, for parents, for school teachers, or pediatricians to say that, look, this child is having problem and this needs to be addressed. I mean, something that the teachers can watch out in the class, or the parents should watch out. Okay, this is because of air pollution, and something needs to be done.
Parents should recognize if the child is not getting good sleep. That is one of the first indicators. The loss of sleep is getting disturbed. And then starts the cycle, less sleep, less alertness, fatigue, not concentrating on studies. Then the teachers come into play, the child is not showing focus. What is the problem? The cognitive and development learning starts to decline. So, and parents should be looking for. Then we all know, patient has running eyes, tears, sore throat, and respiratory symptoms. Those are the advanced picture what you see, but the early sign is a disturbed sleep. And other warning signs we all know: cough, wheezing, getting blue, getting asthmatic attacks, recovers, then gets repeated attacks.
So, my question to Dr. D.K. Gupta, who is the chairman and MD at Felix Hospital. Sir, do you think prenatal exposure that the pregnant ladies have to an air environment which is polluted is going to affect child's growth in terms of having babies who are born preterm, low weight, nutritional problems, and do you think that is going to lead to some neurodevelopmental issues of the children? And how, as a physician, you can suggest some measures by which we can bring down the impact of the prenatal exposure? Specifically, we are talking about prenatal exposure of a pregnant lady to the ill effects of air pollution towards the growth and development of the child.
Thank you so much, Dr. Sudhir, and thank you, Illness to Wellness. This is the, I think, most important topic to be discussed right now everywhere. It's a highly emergency actually going on in Delhi NCR and rest of the world, rest of the India. Before going to the main question, I would like to give some facts. Globally, around 80 lakhs to 1 crore people die because of air pollution, directly linked to air pollution. And out of this 80 lakhs to 1 crore population, around 25 to 26% of the population is in India. Means around 20 lakhs to 25 lakhs people die because of air pollution in India every year. If we talk about children specifically, around 7 lakhs children die globally directly linked to the air pollution. If we talk about the India, 464 under 5 children die every day because of direct link to air pollution. So they are facts actually, this is not data, and this is actually horrifying data. And if we talk about the exposure of pollution in different age group, then definitely, as you rightly said, it starts from prenatal period. If we talk about air pollution, it has lots of components like PM 2.5, nitrous, nitrogen dioxide, sulfur dioxide, ozone. Most of these pollutants cross the placenta and they go in the fetus, and where they cause lots of inflammation and alteration in the organogenesis. Means they alter the development of brain, even lungs, heart, and other organs of the body. And because they cross placenta, they cause their oxidative stress in the fetus and also the inflammation. That cause the alteration in the development of brain and the lungs specifically. If we talk about the effect of the pollution on the prenatal exposure, definitely if a lady who is pregnant and exposed to this high level of air quality index and PM 2.5 level, it means she can have premature labor pains, premature delivery, resulting into low birth weight baby, resulting into premature birth baby, which will lead into lots of complications in the neonate and newborn. They may cause respiratory distress syndrome, it can cause septicemia, NEC, lots of serious complications even in death. So that is one important point that can immediately affect a pregnant lady. If we talk about the impact of the on organogenesis, on the development of the fetus, definitely because it affects lungs. So these children who are exposed during their fetal life to high level of this PM 2.5, they can have lots of lungs problem, like they can develop early childhood asthma, they can develop later on, they are more prone to COPD, even lung cancer, ILD, interstitial lung diseases, even their vital capacity of lung is reduced. It has been seen in several studies. Also, these children who are exposed their brain to this high level of PM 2.5 and nitrous oxide, they have poor lung development, poor brain development. Because of that, these child, they can have cognitive dysfunction, means their IQ level will be low, their focus will be low, their concentration will be low, their attention span will be poor, and overall performance in their schooling and in their academic life will be very poor. Later on, they can develop depression, anxiety, attention deficit disorders, even serious psychotic disorder also in later life. That has been directly linked to the exposure to PM 2.5 and other pollutants. If we talk about other points, in India, our children, they are exposed to more than 10 to 15 times of high level of PM 2.5 as they should have normal air. Means they are inhaling 10 to 15 times hazardous air, actually they should have pure air. I think this is the most important point. And also in India, नहीं globally भी बता रहा हूँ मैं आपको कि globally more than 95% of children they are inhaling bad air, bad oxygen as per WHO norms, as per other international guidelines. This is a fact.
But aren't we different, sir? I was reading the other day, in Switzerland, if the AQI goes above 6, they send an alert.
Yeah.
In Singapore, if it goes above 30, they send an alert. But we are living in an environment where the AQI is constantly above 300.
So in India, I think more than 200, 300, it becomes a new normal right now for government also and everybody else. Like your second question was that what should we do to...
Sir, I think we'll come to that. But I want to ask Madam Alka that, are you seeing some behavioral changes in the children? Are they becoming more anxious? Is ADHD and other, behavioral disorders increasing in the children? Have you noticed that something is changing? Are they becoming more lethargic? Is obesity going up? Is nutritional deficiencies becoming, because you are sitting in the school where you are spending a lot of time with children. You must be seeing these behavioral changes also.
Absolutely, doctor. Actually, since we are discussing this topic, I'm just reminded of a quote by Mahatma Gandhi. He had once said, when you go to a developing nation, don't drink the water. And when you go to a developed nation, don't breathe the air. But we know that this is not possible. I'll just give you a small incident which happened in my school today morning. Not all parents can keep children at home. I represent a school where we have around 100 special children. They have cerebral palsy, autism, Down syndrome, etc., etc. Sometimes I really feel very sad because other children can express and say that I'm not able to breathe, I'm feeling uneasy, but these children can't. Today morning, there was a student who was sitting with his mouth wide open, not able to say anything. Of course, being an Air Force school, we have specialists, special educators, therapists. They manage the situation and made him feel okay. But doctor, you're very right that there are a lot of changes in all children. We have general wing children who are anxious, who have become irritable because they are on the gadgets at home and taking online classes from home. When they come to school, they have adjustment problems. And then we have these special children who have problems of a different kind, and then the primary kids who are doing online classes. Can we call it real education when you are just sitting in front of a gadget? And just a lecture way of teaching going on between the teacher and the student. And then, of course, we have the mischief mongers also, who create a lot of nuisance in the classes. So yes, this is a cause of concern. How will we make every child educated if this happens regularly? And of course, we have behavioral problems, anxiety problems. Children also have, irritants on the skin. So there are a number of issues that the children are suffering from, and this situation is really, really very sad.
Since we are short of time, I think I'd like to put this question to all my panelists. What can we do? I mean, each one of you, to me, getting an air purifier at home or wearing an N95 is not the answer. We have to think of the bigger picture. Fortunately, we are in a globalized world where you can learn from other people. How China could handle their air pollution, how other countries are handling their air pollution. So I think I'll ask each one of you, what is this one strategic step or which you can, I would say the clean air strategy we can adopt to improve the environment of our country. One thing I can think of is, and as a Delhiite who's been in Delhi for last 5 decades, is that I've seen the topography of Delhi changing, the demography of Delhi changing. And why did it happen? If you say a person wants to go to a place where he can get, child can get good education, he can get a job, health is easily available, and that is the reason everybody rushed to Delhi. So the time has come. What China did was that, have to do a reverse migration. You have to develop this B and C class cities so that people go back there. And I'll give you one example. As a doctor, about a decade back, when Rishikesh came up with the AIIMS there, Rishikesh was not a very well-developed city, and people used to come for medical treatment to Delhi. Now Rishikesh has an AIIMS. Around this, they have made an institute, a college, medical college, engineering college. The local markets are there. The tourism has developed. So nobody is coming from Rishikesh to Delhi. So that's exactly which China did, that they developed B-class cities and C-class city, gave them income tax benefits, gave them other benefits, so that there's a distribution of people. If lakhs of people come to Delhi every day, and so many vehicles are going to increase, the pollution is going to increase, because there are lakhs and lakhs of vehicles standing on the street because of the jams, and they are throwing out bad. So what are we going to do, sir? So that is why one strategy, each panelist. What do you think? This is one thing we can do to help Delhi.
So what we are doing, I can say that yes, among the children, it's not just about awareness, but bringing concrete action within their own capacity, because we believe that they are the change makers, and tomorrow they are going to be the policy makers also. So if we invest in them wisely, I've had students who have represented Delhi or country even at UN level, discussing about climate action and other things. So we have included SDGs in our curriculum, we prepare them, we develop them into becoming the change maker. So hope and faith and the right kind of investment, that is what is in our hands. What's not in our hands, obviously we have to hope and look at collaboration or help from other ends, but at least let's not shy away from our own investment.
I think that's a brilliant thing. I think the future of our country lies in the hand of our educationists. Everything begins at school level. If you teach them good habits, treat them how to respect the environment, they will become, I think, responsible citizens. And that's, I think, a brilliant thing that you are doing in the school, ma'am. Anything you can suggest as an educationist we can do in our society to improve the...
Absolutely. I feel, yes, I agree with you, doctor. You said education begins at the school. But I would urge all of you, because Dr. Dwivedi just spoke about in the last session he was talking about the Kachre Ka Pahad, that is called solid waste management. Each hotel, each home, each school should start that, because air pollution cannot be taken in isolation. It is linked to so many other things, firstly. Secondly, we teach our children the 3 R's. Refuse, reduce, recycle. I want everybody to add one more R. Refuse. Anything which adds to these emission levels, just refuse that. Do not use it. I think together we can all do it. But then everybody has to be a part of that campaign. Thank you.
Dr. Sai, what do you think? One strategy for a clean Delhi.
I think it's going to take years, but it has to come through education, civic sense, civic responsibility, individually as a citizen. As ma'am said, make sure you're not generating pollutants at home, make sure your neighborhood is not generating pollutants, have a community participation. Okay, this society, we are having this problem, we need to sort it out, let us do it. And yes, we all know that traffic pollution is one of the most common, it's the most responsible thing for generating NO2 and ground level ozone, which is more harmful and inflammatory along with the PM 2.5 for the pollutant effects. So yes, better switching to emission norms. The automobile industry has to come up to convert these BS4 or government needs to help people switch over to better vehicles, because when you bought the vehicle with the BS4 norm, you bought it with your own investment and EMIs, thinking, okay, I have 15 years, this is my investment and asset. But after 10 years, you are suddenly asked to scrap it off and all. It doesn't go well with the community, where it creates a very political unrest, and this is what happened. And then again, the Supreme Court yesterday said it is again banned. So it's a long-term vision process. The effects will take 5 to 10 years, but they have to start from today.
So the number of vehicles in Delhi is increasing, exponentially. That's what I said. Today we are in a globalized world. We have examples like Singapore, where the number of vehicles are restricted. You know, you can't have more than one vehicle per person, and that too is auctioned. So the number of vehicles which have been on the streets of Singapore for last 3 decades, sir, have been the same. So why can't, I mean, within India itself, I have been to Indore, and people talk about how Indore has undergone transformation and is the cleanest city of Delhi, of our country. So we have examples, and we can go and study what is that happened in Indore that they have a better environment than Delhi. So I think somewhere down the line we all need to wake up and take it up as a on a war footing. And unless we do that, we keep on making lame excuses. As a doctor, I would say that the worst symptom or sign is apathy. You know, when you are apathetic, and that's what I see the people of Delhi becoming apathetic. कि कुछ नहीं हो सकता, ऐसे ही चलेगा. ऐसा नहीं चलेगा, ऐसा हमें कुछ करना पड़ेगा. नहीं तो हम अपने बच्चों को क्या जवाब देंगे? So I think it's time that the people of Delhi, specifically because we are serving Delhi, wake up and they say, okay, we work with the government, but we have to do something on the war footing. Otherwise, we are all going to die a slow death. I'm not mincing my words. We are all dying a slow death. And we are not bothered about it. You know, even in my hospital, when I talk to doctors, says, Dr. Kalan, kuch nahi hoga, aap kyun ja rahe ho us conference mein? You know, that is the attitude people have. But I still would say that I am a surgeon who has been trained to even treat cancer for patients. People who have metastasis, I know they are going to die in 6 months. I still treat them. So my Delhi is going into that, you know, into that stage where it is looks like a terminal city. Everybody is saying that let's go out of this city. So, I mean, I'm becoming a little passionate and this thing about it, but I think that is what really requires. Dr. D.K. Gupta has been with me in SOCHAM, and we have together discussed on many forums, and every year we have this forum, then we talk and nothing happens. Dr. D.K., you want to say something, your comments? Because we have shared this dais many times.
Yes, sir. So I think very good ideas given by panelists. Mostly they are preventive and on long term. But past several years, we are facing an acute emergency in Delhi NCR. And if we want to avoid this emergency next year, then definitely government should have a great will, vigor will, to implement some good clean air policy within a defined time period, with the accountability and responsibility of the stakeholders. Otherwise, we will discussing every year. When Beijing can do it, then why cannot Delhi can do it? Because there was a government will, there was a political will, there was stakeholders, those who were complying the rules and regulations. They shifted all the industries outside their city. They did lots of new things. And the pollution level are very high as compared to Delhi in last few years only in the Beijing. But now they are near normal level also. So I think we all know the preventive measures, we all know the corrective measures, government knows it, but there is a lack of implementation. It is because there is a lack of will, and this is because this is a slow killer. If it is will be acute emergency like COVID, there were lots of implementation. So I think we should need to sensitize government as a policy stakeholders, as a advocacy.
I personally would differ a little bit that we can't live. That is the attitude of our society. We want government to do everything. कि सरकार का काम है pollution को control. सरकार का काम नहीं है सिर्फ हम सबका. बिल्कुल, absolutely. The सरकार has to be tough. Yes, they have to implement it. But I think every citizen has to be responsible, because every citizen is contributing to the pollution. Unless every citizen becomes aware, and the citizens become so aware that the government better not take him for granted. You know, our governments are taking us for granted because, you know, COVID, we could see death across us. I mean, we saw death from close quarters in COVID. But we are not seeing this death which is being caused by the bad environment to us. So I think somewhere down the line, we all need to sit up and, you know, think and discuss and participate and force our government to, you know, do some drastic steps, because I think today what we need to do is take drastic steps to control the environment, because unless we do that, we are doomed. I am not going to mince my word. We are doomed unless we all sit up and introspect and decide what needs to be done. My Delhi is dying. I'm very sadly saying it. I'm 60 years of age. Now I've seen the beautiful Delhi where all the 4 weathers could be enjoyed. Children used to go out and play in the rains. Children used to go out in the winters, run around, play cricket in winters. Where is all those seasons gone, all that fun which is gone? So I think I will just conclude this panel discussion on this very emotional note that the environment is rapidly deteriorating and something needs to be done on our footing.
And I'm myself contemplating reverse migration.
No, I don't think that is the answer. I mean,
you know, this is, we all know that our life expectancy is getting reduced. And everyone, even how much you can do, it's like, you know, everyone has to do it collectively. Schools have to do it.
So
It starts from the basic pillars. The base has to be strong.
So
the schools is the thing that children should be taught about the environment. They are the ones who have to make a very strong impact when they educate others also. Yes, they also, it's their right to have a life, their right to have a
since
clean air.
it is the last panel discussion, I would like to ask the audience, one step, sir, one significant step you think is going to change Delhi? One step. I think 4 or 5 questions we can take from people. कोई लंबी कहानी नहीं सर, छोटी सी बात, सीधी, hitting hard.
आप लोगों ने सारी चीज़ें बता दी और एयर पोल्यूशन एक ऐसी चीज़ है, पानी को तो आप उबाल के पी सकते हैं, खाने का पोल्यूशन भी आप स्क्रीन कर दे। एयर पोल्यूशन ऐसी चीज़ है कि चाहे वो वीआईपी हो चाहे कॉमन मैन हो, वो जब तक प्रिवेंशन नहीं होगा।
तो आप सर आंसर हम सब खत्म कर रहे हैं, लास्ट सेशन है।
सो
वन स्ट्रैटेजी
प्रिवेंशन के लिए 2 चीज़ें बहुत इंपॉर्टेंट है। वन इज इम्प्रूविंग पब्लिक ट्रांसपोर्ट फर्दर सो दैट लास्ट माइल कनेक्टिविटी हो, आदमी जा सके, यूज कर सके, प्रोफेशनल भी यूज कर सके, नंबर 1। और नंबर 2 वेस्ट मैनेजमेंट। वेस्ट मैनेजमेंट अगर हमने कर दिया, और तीसरा कि जिस समय वेदर कंडीशंस ठीक ना हो उस समय कंप्लीट बैन ऑन कंस्ट्रक्शन एक्टिविटी टू रिड्यूस PM 2.5 and PM 10। These are the 3 things and it will reduce the pollution by at least 50%.
I think government is already on the job for this. कोई out of the box solution बताइए sir. I am putting this to all the people. Yes sir.
Waste management is not still.
Sir. Yes.
Waste management.
Waste management. If you within Delhi there are pockets, there are societies. Yeah, there are societies. I stay in a society called Nirvana Country, which was voted as one of the best societies, and I see diligently waste management happening. If you don't do that, they are not going to pick up the garbage from your home, and there are fines, and that society.
वो waste जाके कहाँ dispose होता है वो important
वो
है।
society के अंदर ही उसको बना रहे हैं, पेट बना के वहीं से वो ब्लैक सॉइल लेके STG मैनेजमेंट हो रहा है, सब कुछ हो रहा है।
So these are small pockets. So I'm talking about the whole of Delhi.
Emulate. Yes, sir. We have to kindly conclude. Two questions and we have to conclude. Yes, sir. Sir, keep it short. I want more people to give suggestions.
Suggestions.
Yes, sir.
So first suggestion is that somebody spoke about the automobile congestion in Delhi. As you said correctly, Singapore has 30 years, no increase in the population of the automobile. Same is applicable in Delhi. Delhi population of automobile is 3 times or 4 times more than all the capital cities, tier 1 cities in India. That is the number 1 pollution. Second pollution generation is the dust all around the roads. You go to any roads, there are dust are there. Nobody is talking about the dust. Collection of the dust is by the vacuum cleaners. The truck should be there too. Third point is.
Sir, one point. I mean, I want more people to participate.
Last point. अभी सुबह था तंदूर 1000 तंदूर जल रहे हैं रोड साइड जो जितने भी ढाबे हैं 10,000 समोसे और कचौड़ी रोज तली जाती हैं दिल्ली में nobody unorganized sector is not documented. This is the main thing.
I think everything is adding up.
Yeah.
Thank you so much. Yes, ma'am.
Sir, good afternoon to all of you. Since morning we have been hearing this big monster called air pollution, AQI. So we have to identify the major stakeholders here who can control it. Like, of course, we have so much of policies, everything documented, but we need action on the ground, which I personally feel. right? Like it is not always the government, but of course the private sector. I represent a healthcare industry. I'm from the Rosewalk Healthcare. So of course what I feel that public transport has to be well developed. The pooling system should be there, that the colleague can, pick up, they can combinedly come so that the road, the traffic can be controlled.
So better transport?
Yeah.
Thank you. Yeah. Anybody else?
I just want to add to what she said. We were talking about vehicular emission. If we want people to, buy battery operated cars, then the private players and the government needs to do something about the cost of those cars. Reduce the prices so that people don't go in for petrol and diesel cars, but buy these, green cars. That has to be done. EV vehicles, yes.
So my name is Dr. Rastogi, and I am the person who gave you CNG in Delhi.
Oh, great. Thank you, sir.
And I'm also the person who actually made the small auto rickshaws on CNG. I also have a patent on diesel smoke scrubber, which was used in Lucknow. I have just sent 18 points to the Prime Minister's office and also to the Chief Justice. 1 or 2 points I'd like to mention here. One point should be that all the new vehicles in Delhi should be EVs, so that in 10 years' time, all the vehicles become EV. That will make a huge impact. Second, then there are all these other...
Just two things, sir,
yeah.
because we're running short of time.
The second thing is, out-of-box solution. You have the Yamuna running. Every 250 meters, you have a super high pressure fountain. Super high pressure fountain every 250 meters. So that will reduce the emissions. Thank you.
Thank you.
Hello, sir.
1 minute, sir. I think.
Good afternoon. My name is Advocate Bishamdat. I'm an environmental lawyer. So that solution is already from the solution which he has given. I suggest this all the builders, real estate stakeholders should keep this gun on their roof, so that can bring moisturizer. This is the situation where we can combatantly fight with this air pollution.
Okay. Thank you. Last one. Thank you. Yes, last one. I think we'll have to conclude with that.
Hello, I'm Professor Dr. Rakhi Mehra and representing Ayush Department, and here that illness to wellness, I'm thank to this organizer and who has put this I to V. Till the time school and all the stakeholder will not consider from I to V, we cannot change the thing whatever we are getting polluted. First thing, everybody has suggested nicely, including that. I would like to add one more point. If government can mandate all the construction and all the building, top roof should be having a solar plant and solar energy resources. That is the ideal which I was thinking from my
I think
side.
last one, sir.
Thank
yes,
you.
Yeah, absolutely. Yes, sir. Last comment.
As we all know, Aravalli Hills are the lungs of North India. अभी थोड़े दिन पहले एक नोटिफिकेशन आई थी जिसमें 100 मीटर से नीचे जितने भी आपको हिल्स दिखते हैं वहाँ पे माइनिंग के लिए चालू हो गया। बट अगर हम माइनिंग के साथ साथ ये भी अगर हम रोकें, ज़्यादा से ज़्यादा वॉल लाइक सिचुएशन बनाएं कि हम प्लांटेशन को बढ़ाएं। हर एक इंडिविजुअल अगर पीएमओ अलाउ कर दे या फिर पीएम बोलें कि हर एक इंडिविजुअल को कम से कम साल भर में 365 पेड़ लगाने हैं, इन पीपल या बैंगन ट्री कोई सा भी, तो अपने आप ही प्रॉब्लम सॉल्व हो सकती है।
थैंक यू सो मच। आई थिंक जनता जागरूक हो गई है, अगर जागरूक रहेगी, इफ दे स्टैंड अप एंड आस्क फॉर देयर राइट्स, nobody has that political will to defy them. So what is lacking is Our Delhi has become apathetic. You are not asking for your rights. You are not coming on the streets. You are not fighting. You are not asking your politicians for answerability. The moment your voice becomes strong enough, you will see things happening. Thank you. I think we'll have to conclude with that.
Thank you very much. We can take it, sir, offline. Can we take it offline?
Just one line. Carbon emission norms are stringent for large companies. If we are actually implementing those, then carbon emission norms means carbon emission and the target of zero, carbon that we are having for 70. If we are implementing it at MSME level, with strict regulation, a lot of things can be done. When COVID happened, we have seen how things change when we are in lockdown situation. Large companies are put on hold, on audited space or optics, but not the MSME. If MSMEs are also overlapped, a lot of things.
So I think in our country we have lots of rules and regulations, but it is the lack of implementation which is the main problem. I think thank you everybody for participating, and please don't go and just forget the problem of air pollution. Let's join hands, raise our voice and make it strong enough for the government to take notice of that.
Thank you very much, sir, for an absolutely amazing, remarkable and a heart-touching session. I request Mr. Sandeep Jain, General Manager, Illness to Wellness Foundation, to please join us on stage for the presentation of mementos. We'll begin with Dr. Sudhir Kumar Kalan, sir, to please step forward. The session moderator, can you please give it up for sir, for a very able moderation? Thank you very much, sir. We now present it to Mrs. Alka Singh. Ma'am, to please step forward. Kindly keep the applause going, ladies and gentlemen. Dr. Sai Kiran Chaudhary, sir, to please step forward. Kindly keep the applause going. Dr. D.K. Gupta, to please step forward. Mr. Sanjay Yadav. Thank you very much. Kindly come together for a group photograph.
Of environmental pollution.
So we'll definitely take care of this in our future events. Thank you for your valuable feedback. Thank you very much, ladies and gentlemen. With this, we conclude this very relevant conversation and conference. As most of you have already gone for lunch, the rest of you can please join for lunch. Thank you so much, and we wish you a great day ahead. Thank you very much for your participation and support.